el área. Hablamos con Reba
à porter ce masque en tissu. Les enfants ne portent pas de masque, ce sont des petits enfants.
Traditional firework display did take place over the iconic Eiffel Tower, but members
as a function in our society, a symbol, and you're vital to democracy. And if higher ed shrivels, all society suffers. And we feel this is very much in line with what we're trying to achieve here. And that is creating a balance. We're part of a network of higher ed in our state that's really integral to the future of the state and the future of our young people. And what we're trying to do is create that balance to create a plan that is as safe as we can create it. We know we cannot completely eliminate the risk of COVID, but at the same time, we're trying to sustain that contribution to the future of the state, economically, culturally, innovation, and the education of our young people and basic research. Next slide, please, Sarah. We're working on the next slide, I think. There we go. So in order to do the health and safety plans we think this requires, we have a long list of things to achieve. And first you can see there is public health guidance compliance. And so that's going to require a robust testing capability, lots of PPE, making sure that we've radically stepped up our cleaning protocols and supplies, and that we have the way to manage our own contact tracing and containment process. That also includes, we've got to reduce the density on the campus. So we're working on everything from living and dining to research facilities and how we teach, and we'll talk about that. And then we're intentionally rearranging the way we manage students on the campus. So you used to get assigned to dorms in lots of different ways. Now you get assigned by what your college is and what your study interests are, so that we can get you with a cohort of students that hopefully you will take all of your classes with, so that we can reduce your interactions across the campus. At the same time, we've done an overhaul of training and compliance requirements for faculty, staff, and students. And at the same time, we recognize we've got to be flexible. We've got to be able to turn on a dime with the situation as it evolves around us, and also to allow our vulnerable and at-risk population to access education. Next, please, Sarah. So this is the basics. We are rearranging that physical environment and our academic operations to reduce that person-to-person infection contacts, and then the standards, distance, face coverings, and reducing our population density. Next, please. So 2 key elements. We updated our own campus safety policy on June 23rd, which reflects the health ordinances that we see. And then the student code of conduct was updated on the 25th, which clearly reflects the health ordinances, state, county, local, and also our new policy, and specifically calls out face coverings and how they're to be utilized. Next, please. So testing capabilities. In the spring, we in the state didn't have much in the way of testing. We didn't have contact tracing, and we certainly hadn't figured out our facilities how to do distancing or isolation. So in the fall, we have requirements for incoming students that are living on campus to provide a proof of a COVID test 5 days before arrival, or when they get to the campus, we'll do both clinical and rapid testing. We're planning to do ongoing surveillance testing. So that's pool testing, where we can look at a community and see if there's any occurrence that requires more in-depth testing of that group. And then we're going to be doing something with wastewater on 20 of our buildings to also see if there's anything that would alert us to problems going on with the community in that building. Next, please. We will also provide on-campus testing for high-risk individuals that may be based on their role or contact. So if you're in a role where you're coming into a contact with a lot of students all the time, we may put you in for testing more often. We're developing our on-campus capability for doing this for students with symptoms, and we're planning to offer faculty and staff testing when they've been identified at risk, either through contact tracing or some activity they may have been involved in. We will do additional monitoring to detect the emergence of infections. So we're going to do a number of things. Obviously, we're going to do wellness and reporting, and we're requiring that now with faculty, staff, and students that will be on a daily basis. And then we're going to do some addition testing to high-risk periods. And you know, what might be a high-risk period? It might be we had a particular crush at move-in, and we want to test that group and make sure that nothing has happened there. So it'll depend on locations and other things. We'll make those judgments as we go. And we're constantly looking for new testing capabilities. Fortunately, we're not short of a few rocket scientists in this area, which is a wonderful thing to have in our community. And they are working feverishly on solutions that can help us with testing and detection overall. Next, please. So we're also working on developing a contact tracing ability, and we've trained a number of students in this. And just one aside here, in the most recent uptick in cases in mid-June, we had a real compliment from the county that said they could not have gotten through all the contact tracing they had to get completed in 24 hours if it had not been for the 50% that were done by our students. So we're actually setting this up as an MOU with Boulder County Public Health. We will operate hand in glove with them, and a lot of it will be our students, and we're setting it up so they can actually get some credit for doing this work so that we're fully coordinated with them. We're requiring students, faculty, and staff to complete these health surveys I mentioned, tell us what their health is like, so if something's amiss, we can follow up on the next steps that need to be taken. And we have facilities that are designated for isolation and quarantine. And we hope that these combined strategies are going to support our efforts to maintain the health and safety of the campus and therefore the community around us. Next, please. So equipment side, and what are we doing in buildings? We have ordered quite a number, as you can see, reusable masks and also disposable masks so that we have those for all students, faculty, and staff. And then the facilities team is working overtime to determine how we're going to do all our spacing. What are we going to do in terms of supplies for the buildings, air filters for some of the buildings, and then even plexiglass that can be used to divide people functionally, say in the bursar's office. Or maybe it's even for a student who needs to practice clarinet and cannot keep his mask on. Next, please. So the key, we think, to this about keeping our campus healthy is also keeping the broader community healthy. We are all responsible for social distancing, and we are responsible providing our community with masks and training. Those trainings are going to be required for all faculty and staff, and they're going to cover all the requirements of what we expect students, faculty, and staff to adhere to. And the students are going to be required to do that before they arrive, and there are holds on their accounts if they haven't done it. And then if each unit within the campus needs to do a complete risk assessment, so if I have a teeny weeny little lab, I may have a more difficult situation in terms of distancing with my researching students than if I have a bigger space, and all of those things are being assessed with a plan being put forward for each. Next, please. So just to summarize, for students who are in on-campus housing, they have online training, testing 5 days before arrival or once they arrive. They are subject to all of our changes in policy and code of conduct, and there are consequences for that. And we're asked frequently about that, how many strikes and they're out and those kinds of things. So the consequences are going to range depending on the situation we find in that particular student. We have a very great, a wonderful group of student advising that looks at each case and works with each of the students. So it can be everything from education, restorative justice, to the extreme cases where we may do an exclusion or a suspension. Masks will be provided for all on-campus students, 2 cloth masks. We're going to do an extended move-in. So instead of doing it in 2 or 3 days, it'll be spread out more over 5 so that we can have fewer people moving into the residences at one time. We're going to have lower density within the residences, and we're going to restrict who can come into the residences. Parents can come and help drop off, but they can't just come visit. Your friend from the next dorm cannot just come visit you in your room. And then we're changing our dining, so we have a new capability. So students can order their meals online and pick them up, or they can come in for limited distance dining or outdoor dining. Next, please. So for off-campus students, we're determining the testing requirements for those students and our overall capabilities. We're going to incorporate any public health requirements for those students living on campus, and particularly those that are arriving from geographical areas with increased COVID infections. So the policies and codes All that applies to you if you're living off campus, just like it does if you live on campus. And in fact, CUPD and BPD have been working with our Student Code of Conduct and our off-campus housing office so that they can have a much closer reporting section and response for the students. So there's a desire to do education, but it doesn't mean they can't send us a report. And your new chief, Harold, has instituted that process. And in fact, she and our chief were on the phone today to look at that process, how it's working, and how speedy it is. So their goal is to get it down to, we need those reports and we need them within 24 hours, ideally. So that's something that we've all committed to make happen so that we can give timely response to those reports in the neighborhood. Again, 2-cloth masks for those students as well. And testing is available for them on campus for any students showing symptoms, or if they're part of something where we have contact traced and found that they've been exposed. Next, please. So the complexity of this plan is for 19 different modes of operation. And what that means is, what are we doing with everything? So there's extensive information that has gone out to our faculty on how they can prepare their classes to be remote, online all the time, a combination, what are the requirements? So there are a lot of tools that have been developed for them. Same thing for staff and of course students. So it's everything from being completely online to all the way back to through this hybrid thing that we're talking about for the fall, all the way to back to normal. And so those are going to be looked at and the data for that on a regular daily and weekly basis and provided to the chancellor so he can make decisions on this with a comprehensive set of recommendations from his health and safety experts based on key monitoring factors. Next, please. So you might ask, what are those monitoring factors? And Sarah, if we can move to the next one. So these are a little hard to see, so I'll kind of read through them. We have a number of things we want to look at. First, there are external conditions. So what are the status of the current government orders regarding everyone or higher ed in particular? Monitoring CDC and guidelines for institutions of higher ed. We've got to monitor those. And we are, by the way, in regular contact with our peer group from AAU and also from Pac-12. We are regularly comparing notes and looking at best practices. What's the increase in COVID infection rate? What is the status of local schools and our fellow higher institutions around the state? On the campus, we're going to look at what are the availability for face coverings? Do we have a shortage? Do we have what we need? Availability of PPE for our health and safety personnel, so at Wardenburg in particular. Utilization rate of our campus contact tracing capability. So if we could do 100-day, are we at 20 or are we at 50? Is that going up or down? Quarantining, how are we using our quarantining and isolation space? And what's our utilization rate with our local healthcare providers? And then looking at the effectiveness of our controls. Do they need to be changed? That's one thing we're going to look at. We're trying to reduce campus density to 45% of pre-COVID levels. We want to see how our health questionnaire completion rate is faring. Where are we getting outbreaks on campus? Are they singular in a dorm or do we see a cluster, and how are we reacting and containing that? And what are the number of warnings and violations that are being issued to students, and where are we seeing that, and how can we follow up promptly on those? So that's pretty much it, which takes us back to our last slide, which is what are we trying to achieve? And that is this tension and balance of trying to keep the community safe. We know we can't eliminate everything, but we want to do the finest job we can with the brains that we have behind this and help keep the state and our community competitive and a bright future for our young people. And with that, I will wrap it up and turn it over to questions, which I think you'll mostly want to ask of Pat.
Great. Thank you so much, Francis and Patrick, for being here. First question is from Rachel.
Hi, Francis. Hi,
Hi,
Pat.
Rachel.
Nice to virtually meet you as well. So I have a couple questions that are focused on, I would say, the off-campus housing situation. So it sounds like you've reduced density for on-campus living. Are there fewer students overall coming back into the community though? I have a multi-part question. That's probably part one.
Let me answer part one, and let me back up one step, which is when Francis was talking about reducing density on campus, we're going to have close to normal cohorts within the residence halls. What we're trying to do is reduce the overall number of potentially infectious contacts to about 45%. And that's done through a number of different modalities. Part of that is by reducing density within classrooms and buildings. Part of that's being done by social distancing, and part of it's being done by physical measures, whether it's plexiglass or otherwise being able to control the physical environment. But the density within the residence halls is going to be pretty close to normal within a residence hall. And what we're really trying to do is prevent the number of times that you mix the deck. And that's why there wouldn't be different, there would be different cohorts, and that those people would largely take their classes together rather than be interspersed, because what our epidemiologists are telling us, it's not so much the density within a residence hall or in a single building, for example, it's the contacts that people have in the outside of those environments. So wanted to just make sure that was clear, that we're not actually reducing the number of students that much who are living on campus. For off-campus students, we're looking at what our enrollments are going to be, and enrollments are fairly normal. They're not completely aligned, and one thing we've seen in particular is a drop in international enrollments, but our overall enrollments seem to be fairly normal. And that assumes that we don't have melt over the course of the summer and people who have confirmed decide that they're not going to attend. So we think that the student population in the overall community is going to be fairly close to normal.
Okay. So in that case, it concerns me to hear that we would only be testing students who are on campus, because off-campus students also, I would think, have a decent chance of spreading the virus to each other, and could be living in homes with a number of people. And just to use my own family as an example, so I've got a student at CU, so he'll be coming from my home where my husband works in the ER, and could certainly come back with COVID at any time, could take it to campus, or could take it from campus and bring it into the home. So it seems relevant that the testing would also apply off campus. So I'm just wondering what the rationale is for not doing that.
So let me walk you through the testing ideas, and so that you understand where that's coming from. We are requiring all students coming into the residence halls to be able to get tested, because we have the ability to check them in. But we're also going to be working, and we're going to have the ability to run up to 9,000 tests in the first week. We're not just going to be limiting those to residence halls, but we're looking for other high-risk places, whether that might be fraternity houses, sorority houses, other places, so we can employ testing there as necessary. The other thing that we're going to be doing is that we're going to be doing another type of testing, which is pooled batch surveillance testing. A test is only good for the moment that it exists. And that one of the things that we also want to be able to do is build ongoing testing capabilities, not just on campus, but in the community with those populations when we have reason to believe that there is a place where there could be risk. So off-campus students are part of our batch surveillance testing. We've developed the capacity to run up to 900 pooled surveillance tests per week. And then we're also going to be working on some of the other testing modalities that Francis mentioned. You may have seen that one of our researchers has been working on technology to be able to use saliva-based tests, which aren't as invasive as PCR tests and wouldn't impose the same type of burden in the community. So we're going to have multiple testing modalities. We're not probably going to hit every student that comes on into the community, but that we do have strategies that will encompass the overall community, including off-campus students.
And can I add, Pat,
I'm
that
gonna
a lot
stick
of
with
that
feedback
has
just
to
a
do
little
with
bit on,
capacity.
go ahead, Francis.
I just want to say we're working on the capacity of the test to run also. And as Pat said, other ways that we can test that don't necessarily rely on the current backlog that we see in the labs around the state.
Yeah, well, I just stick with, I think it would be helpful if we were testing all off-campus students who are coming in, especially from other places, but also local. And then my last question is, in terms of quarantining, if you have a student who's off campus, say living with 5 other students, can they quarantine in the sort of safe places on campus? Or the quarantine set aside spots?
The answer is possibly, and it would depend upon the situation. If you have a student who's living off campus in an apartment with 1 other person, that's probably not going to be somebody who we would say, let's move them into a reserved quarantine setting because they're not different than another community member. On the other hand, if we identify a student who is infected or potentially infected, who's living in a riskier environment, that would be the type of student who we'd want to be able to move into isolation and quarantine on campus. So we're going to be balancing that based upon an assessment of the situation of the particular student who is potentially exposed. We don't want to overwhelm those facilities by potentially moving everybody in if they can effectively quarantine in place like another member of the community. So we'd want to assess that on a case-by-case basis.
Okay, and that would that be the same thing with on campus? If you're just living with 1 other person, you also wouldn't quarantine?
It depends. I mean, we're going to look at it, and then it depends on the living situation. If that person, for example, were in a dormitory that had a communal bathroom, we would probably move them into an isolated space. Where if there is somebody who would be in a contained housing unit that has a bathroom, then that person's less necessary to move into a dedicated isolation quarantine space.
Okay, thanks.
Thanks, Rachel. Folks, we had a little bit of a technical glitch, so some of the hands that were raised got inadvertently lowered. I have Aaron, then Sam, and then Mark. If you're somebody other than those 3 people and you raise your hand, just re-raise your hand, please. Aaron?
Right, Francis and Pat, thanks so much for that presentation. Appreciate the comprehensive approach that you all are taking. Just to follow up on a couple things that have been touched on briefly already. Francis, you mentioned about the testing and the backlog, because we are hearing that testing at the state level is taking a week or more to be processed. So what are you all going to do to ensure that those tests are processed quickly?
We've entered into an arrangement. Quest Laboratory will be providing our testing capabilities, and so we'll be working with them. The other thing that we are going to be doing is, as I just described, is we're working on some of the rapid response tests, which we can use for screening. That's not a full PCR test, which involves the nasal swab, but we think that we're fairly close to having technology available that will allow us to do a rapid screen, which would then allow us to be able to act more effectively and not be subject to the same delays.
And you'd be able to do that yourselves as an organization rather than relying on third parties?
Correct.
Yes.
Okay.
And that's the beauty of maybe extending that to more off campus if we're able to do that.
Very good. And so I'm hearing from reading about other institutions across the country that are having a quarantine period for arriving students. And it sounds like that's not an approach that you all are taking. Instead, you're relying on testing kind of to make sure everybody stays safe. Is that fair to say?
I think that's fair to say. We are looking at whether or not if we had students who are arriving from localities that have a much higher incidence, that might be something we need to address. But we don't have the capacity to have full quarantining and isolation for everyone who's arriving on campus.
Sure. Okay. Well, and I'll just sort of piggyback on Rachel's point. This does sound like a really thorough plan, but the not necessarily testing every student is something that does raise a concern, I would say, because of course you will have students coming in from all over the country, including places where incidents are much higher than they are here. So, to the extent that you can roll that testing out to every student that arrives, rather than just on campus or as close as you can get, I think us as elected officials and our citizens would feel better about that, more safe.
Thanks, Aaron. Sam, then Mark.
Great, thank you. And thank you, Francis and Patrick, for being here. It's great that you were able to arrange to give us this briefing on such short notice, so 2 thumbs up for that. I just got back from a weekend spent around 10 college and high school age students, and I can tell you that what I observed was that they don't seem to be concerned about the issue of COVID transmission amongst each other. None of them wore masks, and all of them were pretty close to each other to the point of hugging from time to time. And this is a natural thing for this age group, right? There's nothing, no bad reflection on them. It's their natural instinct and the way they've been raised. However, we're in a different time. And so, you know, one of the experiences of college is getting to know new people and, you know, circulating kind of widely among different groups. And so I think it's great, say that we did what Rachel and Aaron hoped for and tested everyone when they got here. That's fantastic. However, there's going to be community spread. And the thing I'm most concerned about is how we both educate and then, especially off campus, monitor the behavior of folks. House parties are one thing, and we have a hook into the landlord there if there's a report of overcrowding or too many people. But I'm really concerned with what kind of message is going to be given to the students about this being an extraordinary time and the behaviors that are needed being extraordinary. And I think the obvious response that you will get from many is we're young and we are likely to pass through an incident of COVID-19 as if it's the flu or less. And it's really about the other folks in the community, and the concern that's being raised is how do we make sure that students don't revert to the behavior that is normative and normal in times that there's not a pandemic. So I was just curious how the university is going to approach the bulk of your students who are going to live off campus. And let's assume that house parties are dealt with and residences are dealt with. What about the bars? What about, you know, all the other opportunities? Will you be offering alternatives as well as education? So just please kind of let our community know how you're going to look at the non-campus part of this equation.
Yeah, and that's an excellent question. I appreciate it. So the first thing we do have to start with is exactly what you described, which is education. We have developed COVID modules that every single student has to take as a condition of their enrollment for the semester. If they don't receive those educational modules, which cover social distancing, proper sanitation, social distancing expectations, how to behave in groups, all of those type of things, you can't register and there's a hold on your registration process. But we can't treat this as a single moment in time. We have to start with training. We then also have to continually reinforce the message. And we are going to be doing that through a number of communications. We're also going to be enlisting CUSG, which is our student government representatives, to be able to help us serve as liaisons in working with our student population to remind them of the necessity of being able to engage in proper behaviors. Not surprisingly, we have found that students are more receptive to those messages when they're being reinforced by other students on a continuous basis rather than coming from university administrators. We'll be doing specific education, and one of the things that was important for us was to modify the student code of conduct and to make students aware that there are consequences for their behaviors. Those consequences will apply both on and off campus. As Francis mentioned, a lot of times our first approach on those educational consequences or the consequences for violation of the student code of conduct, we want to start with educational approaches, We want to try to make people aware of their responsibilities. As you may have seen when we did have the COVID outbreak that broke out in the first couple weeks of June, part of what Chancellor DeStefano communicated clearly is that their ability to be able to have the educational opportunities that they've said are important to them and that were reflected in the slide that Francis projected at the beginning, talking about the importance of having education in person and not just having it be done remotely. We know that's contingent upon their ability to be able to conform their conduct in ways that will allow the community to remain safe. And we will continue to reinforce that message. We will continue to also conduct surveillance testing, and that will be a constant reminder of the presence of the disease in the community and the consequences of not being able to maintain it. So we're going to be in the position where we're going to have multivariate strategies for being able to do exactly what you described, which is impress upon them the contingency of us being able to return them to campus and to keep them on campus depends on their ability to be able to meet their expectations. One thing I think is important is that I was looking at some survey data this week that really shows that, notwithstanding the experience where some of your young people were in a group together, as a whole, young people first believe that COVID is important, that it is something that is likely to get worse before it gets better, and they have more receptive attitudes towards things like social distancing, wearing masks in lots of settings than a lot of other 20 and 30-year-olds do. So we need to tap into that inclination and get them to understand that that's not just an expectation when they're going to a store, but it's also going to be an expectation when they're in class and when they're in social situations to be able to maintain the health of the community.
And I might just add, Pat, that we just met with our CUSG leaders, and they are working with our communications team. We're about to launch a whole campaign on campus reinforcing all of this, and they are developing their own campaign to put out to students. And they said they would love to come and talk to you guys at some point about how they're planning to approach students overall.
Great, thank you. Those are great answers, and I appreciate it. We look forward to hosting CUSG and hearing what the student government thinks about how to best manage the interaction between the students at CU and the rest of the community. And I had one other question, which is I've been reading about some other universities and their plans, and some of them have adopted hybrid modes where they're trying to reduce the number of in-person classes that students will attend in order to reduce the density on campus, so that you might have 2-day-a-week classes where students attend in person on Tuesdays, and then on Thursdays they take it online, and then vice versa for the other half of that class where they take it online on Tuesday and attend in person on Thursday. So are those strategies something that you guys are considering?
Yes, we're in a hybrid model, and quite simply, we would be unable to offer a full complement of in-person courses. For example, because we're going to have social distancing in the classroom, we won't have the ability to offer the type of large lecture courses that we previously had. And so every student will have online learning. There will be occasions for students to have in-person learning, but when we're returning students to campus, we need to be very clear that it's not going to be the same experience that they might have had a year ago, that this is going to be a situation where they're going to be learning through multiple modalities rather than just through in-person instruction. And that not only reduces the density in the classroom and on campus, it allows us to make sure that people can continue to advance towards their degrees and make academic progress at the same time. So we have to employ all those strategies.
Very good, thank you.
I have Mark, and I don't have anybody else with their hand up. So if no one else has a question after Mark, I'm going to jump in.
Okay, Patrick, Francis, first I wanted to thank you for what appears to be a very well thought out and comprehensive plan. I know we all hope it's going to be successful, but I have to commend you for what you have done and the effort that you've made. With respect to my questions, the first one was essentially asked by Sam, so I don't want to repeat myself. My second question is about the rapid screen test that you're hoping to develop. I assume if that proves to be successful, it will be rolled out to the larger community?
Yeah, we're currently in the process of trying to be able to develop that test, and that we know that it will be something that will be in demand, not just on campus, but I imagine be valuable in lots of communities.
You think? Yes.
Yeah, we think.
Good luck. I hope you get it. Thank you.
Mary, and then if no one else, I'll go. Mary?
I just have a very simple thank you to provide to Francis for responding to my questions ahead of time. Thanks very much.
Yeah, you're welcome.
I just want to echo what comments were made by, I think, Sam and Rachel. You know, we get a lot of emails from our community. I'm sure you do too. We all live in the same community, and we have a lot of concern, especially among residents on the Hill. And we all know that more than half of the people who have tested positive in Boulder County are between the ages of 20 and 29. Not all of them are university students, but many of them probably are. And as Sam reflected, you know, sometimes younger people don't always understand risk. I just literally within the last 10 minutes received a text from my family that my 3 nephews who live together, they're in their 20s in New Jersey, have all been exposed and are being tested positive. So you know, I think that, you know, oftentimes kids don't make good, young people, not kids, don't make good decisions. And, you know, anecdotally, I will tell you that, you know, whenever I'm downtown, I see just a stream of young people crossing the 11th Street Bridge into downtown, rarely a mask amongst them. And I know that's not something the university can control, but obviously our education efforts are not necessarily working if we have so many people who are exposed that are in their 20s. And anecdotally, we just see lots and lots of people coming from the Hill to downtown without not just carrying masks and not wearing them, just not having masks at all. And one program that I think has been pretty effective downtown is an ambassador program that Downtown Boulder Partnership has. And so they have ambassadors who are wandering around downtown with masks on, of course, but also a mask at the ready, so that for those visitors to downtown who have forgotten to bring their masks, they're provided a mask for free. And I can't remember if you mentioned this in your peer support part of your presentation, Francis, but if you haven't thought of it already, I suggest that maybe one of the things that the student leaders could do is have an ambassador program on the Hill where they can walk up and down the Hill with masks available, and as they see peers not wearing masks outside, to offer them free. And also downtown, I'm sure the Downtown Boulder Partnership would welcome students to join their ambassador programs, because in the evenings, oftentimes a large percentage of the people that are downtown are students. And so I think it's not just paper and video education, it's actually on the ground education, where you see someone without a mask and you walk up to them and say, you need to wear a mask, here's a mask. And I think that type of reinforcement is better than forcing someone to watch a 5-minute video, because 10 minutes later they've forgotten what they've been told. But if they're embarrassed by being asked to wear a mask, that's probably the last time that they'll not wear a mask, one would hope. So
I love that idea, Bob. And I know that Jeff Morris, who's has student ambassadors working for him in that off-campus student housing association, they would be interested in talking about that. I love that idea, and I love the idea of partnering with the downtown area.
Sure, just reach out to Chip. I'm sure he'd be happy to have student volunteers.
Yes,
Great.
I'm sure would.
I don't see any other hands up. Any other questions before we let Francis and Patrick go? Okay, seeing none. Francis and Patrick,
Can
go
I
ahead.
just say one thing? First of all, we really, really do appreciate this invitation, because I think it's really important that we stay in close communications. This whole plan is developing daily. The capabilities that we have are developing daily. We have some great folks at our biosciences department that are helping us with a lot of the assessments and how we're going to go about this. And we're hoping that we can be a big help to the community and eventually the state in some of these things. So the more we can talk about this, the better, I think. So if you have any questions, please don't hesitate to contact us.
Great.
Yeah, thank you for having us. I really appreciate the opportunity and wish that I would have met you under different circumstances, but I look forward to working with you in months to come.
Well,
Yeah,
thank you.
someday we'll all get together and have a beer.
Yes. Well, thank you so much for being with us and presenting tonight. And this was as much for the community as it was for council and our staff. And I know we have a lot of people who are watching this program tonight. So thank you for getting the word out to our community about the great plans you've got. And perhaps we can have you back in 6 or 8 weeks and have you give us a quick report on how the beginning of the semester got off to a good start.
Yep, happy to do it.
Great.
Thank you.
Thank you. Jane, I'm going to turn it back over to you for our second presentation on financial matters.
Thank you, Bob. So the second presentation will be one that we had promised you a couple of weeks ago, and Cheryl Patelli, our Chief Financial Officer, will be presenting the current update on financial matters. Cheryl?
Thanks, Jane. Good evening, Council. We do have a PowerPoint. I'm not sure who's running that tonight.
I'm pulling it up right now.
Okay, thanks, Sarah. I appreciate it. So we're going to have an abbreviated presentation tonight compared to the ones you've seen the last few months. But certainly if you have any questions along the way, let us know. I'll start off with a revenue update. And really, I'm going to focus mainly on the May sales and use tax results. And then Carl will talk about our 2020 and 2021 and beyond revenue forecast. We just received an updated modeling run from CU. Things didn't change, but there were a few slight changes that we want to talk about tonight. So
Looks like it's sorry, I'm not sure why that feedback is occurring.
yeah.
Can you see the slides at this point?
I can see them, but it's not allowing me to advance. Okay, I think I just got something that might, no, it's still not allowing me. So I think you might have to run it.
Would you like me to advance the slide?
Yeah, if you
Sarah?
could, that would be great. For some reason, it's not allowing me to do that. So you can go 2 more slides, please. Thanks, Sarah. So May sales and use tax data, again, May does include a partial reopening, which is a little different from what you saw in April. Although we're saying processing is not complete, the data or the returns were due June 20th. So we do believe that the majority of the returns are reflected in the numbers this evening. And as you can see in related to our delinquencies, they continue to improve since the COVID pandemic began. In March and April, we saw many businesses deferring payments or waiting to see what federal stimulus money they would have. And most of the delinquencies during that time were in eating places and storefront retail. You can see in May, we have about 3% of our taxpayers that have filed but not paid. But certainly in the coming weeks, we do expect that number, or that percentage to decrease similarly to the March and April percentages that you see here. Next slide. So this is that busy slide again that shows May sales tax, both month over month May, which is in the 7th column there, and then year to date May, which includes everything from January through May. And it's important to note that while we experienced a significant amount of late payments in March and April, the month over month have been normalized or changed to reflect if we received a April payment, let's say at the end of June, we actually put it in the April numbers. We felt that that would be a better way to give you an apples to apples comparison year over year. So the percentages that you see here might differ slightly from what you see in the revenue report on the web, but that relates to the fact that we normalize these numbers. And I will talk about a few of these categories that the larger categories in the coming slides. I do want to say something about computer related business sector. The reason why that's up so much is related to some audits that we've completed. So that audit revenue is reflected in these numbers that we're showing you tonight. And I'll talk a little bit about eating and grocery in the upcoming slides, but you can see the same type of categories, retail, home furnishings, are all still down very much since COVID began. Next slide. Thanks, Sarah. So this slide, as along with the next few, represent year-to-date amounts. They don't represent month over month May, it's year-to-date May. And eating places represent 16% of our sales and use tax. And like I talked about last month, a lot of this relates to the fact that we are an in-commuter and tourism community. So because a lot of things have been canceled, the Boulder Creek Fest, CU commencement, those types of cancellations very much affect our sales tax revenue, especially in the eating places category. Next slide. General retail continues to trend downward. Year-to-date March, we saw was up. We talked about the online retailers. We talked about the stock up effect in March. And year-to-date April is down, even though we have the online retailers, the steep declines in brick and mortar have really offset any gains that we've gotten in that area. I think it's slide number 7, Sarah, but you can go to slide 8.
Let me stop share and get back to your slide in a moment, Cheryl.
I'm sorry, what?
Let me stop sharing and get back to your slide in a moment. We're having a glitch here.
Okay, thanks, Sarah.
So Bob, if I might ask a question while we're waiting, I'm looking at slide. There are pie charts, Cheryl, in many of the slides where you're breaking it down by the different types of sales tax. And there's in the pie charts, there's a wedge in the upper right. What does that wedge represent?
That represents the percentage of total sales and use tax that this category makes up. So if, Sarah, can you go back 2 slides, please? Thank you. So in this eating place example, that wedge represents about 16% of total sales and use tax collection. That in the year 2019, that's what percentage eating places represented.
Thank you.
Thanks. Okay, can you go up 2 slides, please, Sarah? So we're looking at food stores. Again, food stores have outperformed what we expected. A lot of that was the stock up. Also, as a reminder, it includes liquor stores, which have done very well during the pandemic. And it's worth noting that we are still seeing gains, although we had 2 closings in the year of Lucky's and Liquor Mart. So as you can see, though, the increases are starting to become less and less, which is what we would expect because of that stock up effect in March. Next slide. Accommodations and short-term rentals. Tourism is almost non-existent. So of course, this area has been devastated by the lack of tourism in the economy. So we are down nearly 60% from last year as of May. And as I mentioned last month, the Convention and Visitors Bureau has estimated a $4.3 million drop in revenue for 2020. And they're still working on their 2021, but they have been using our numbers for now and will adjust accordingly in our modeling to come. So this is an area that we're going to continue to monitor, but continue to expect large decreases over last year. Next slide. So this chart shows a lot of the other different revenue sources. General fund revenue in these areas for May down 52 to 100%. Year to date down 36 through 80 for general fund. I do want to point out a couple bright spots. Building permits and right-of-way permits. So under the building permit revenue, the increase in May is tied to one very large high dollar value project that had several large permit payments that month. And if you looked at the heat map, you also saw that construction use tax went up in May, and that was related to that same large project that occurred. And then the right-of-way permit revenue, that increased. It's tied to several different things. One significant permit payment, several permits for the city's fiber backbone project, and then payments from a backlog in March and April. So a lot of folks came in May. So that is a bright spot among the rest of the revenue for the city. And then I have one final slide. Sarah, if you can, before we move, this is actually a new slide that we've added to the presentation that I think is really interesting. I will note it is sales tax revenue through April. We were unable to get some of the community's May information at this point, so that's why it's through April. But we looked at neighboring communities that post the reports, and we also decided to include Fort Collins and Colorado Springs. And as you can see, the performance of Boulder was really in line with Fort Collins and Colorado Springs. And the smaller bedroom communities on this list generally fared better overall. We think a lot of that, at least for Boulder, relates to our in-commuter and tourism that I discussed earlier. Longmont's kind of in the middle, that economy is increasing and getting larger. Food stores, eating places, general retail, and lodging underperformed again in the city of Boulder. Again, everything that we believe is because of the in-commuter and the traveler spending, the lack of traveler spending. And that's all I have for the May revenue numbers. Do you have any questions before I turn it over to Cara?
Cheryl, I'm not seeing any hands raised right now.
Okay, thank you.
Okay, thanks, Cheryl, and hopefully you all can hear me. And good evening, Council. Cara Skinner, Assistant Director of Finance. So I'm going to cover, if we can advance to the next slide, please. Thank you. The revenue forecasts. And as Cheryl mentioned earlier, we're doing a sort of abbreviated presentation tonight because the picture changed somewhat, but not significantly. So next slide. So this is actually a repeat of a slide that we had in our deck last month, and it's just a reminder that for sales and use tax, CU has built an econometric model for us, so we are using that. And we are largely using it for sales tax and vehicle use tax right now, and we are taking it as a piece of information combined with information from our planning department with regard to construction use tax. And then we are also using our conservative forecast for business use tax. And then for other revenue, we are continuing to consult with experts within the city and outside the city to estimate those revenue sources. So next slide. Okay, so this, since we're not in presentation mode, I was hoping to walk through this slide line by line. I don't know, Sarah, if you think it might go, but if not, I can do it just through words, but it is a lot, so.
Let me see if I can make it work. Just give me one moment.
Okay.
Sarah, if it's not working, that's fine.
It's not working. We'll have to.
Okay, that's fine. I'll try to talk through it. So first, let me say that this is similar to the slide that CU has presented to you. And it shows their total sales tax forecast over the years 2020 through 2025. And as you recall, they had 3 different levels: high, medium, and low. And the medium is the most likely, and then the high and the low are the bounds around that most likely. If you think of their model generates a range of results, and you think of sort of like a bell curve, and the most likely is the medium, and the high and the low are the bounds. And the color coding here is such that the lighter colors, so the lighter green line and the light gray line and the lighter orangish line, are last month's results. And then the bolder lines are what the new model run generated. And so we kind of were focusing on the medium because that's the most likely result. And what I think you can see for all 3 of these is that what happened with this most recent run is that 2020 fell in every instance. It fell to a lower value, but then the trajectory improved, and it improved even beginning in 2021. So each one of those darker lines is above the lighter line. So the trajectory is better for all 3 instances. So next slide. So this is just a duplicate, but it has this oval on it to just draw your attention to 2020. And what I wanted to draw your attention to is that it has dropped, as I mentioned on the last slide, a little bit, and that it's also compressed. So before the range was $11 million, and now the range is $9 million. So as we move through the year, we would expect that it's going to compress as we have more actual data to rely upon, and we have fewer months that we're forecasting for. The range of possibilities should tighten up. And we're going to provide a little bit more detail with regard to 2020 on the next slide. So this is similar to a slide we presented last month, and I recognize there's a lot of data on this slide as well, and I promise we won't continue to add bars as we move along through the year. But I did want to just this one time add a few more. So if we start from left to right, the yellow on the left is the high bound that we saw last month. And then the blue bar is the high of this month. So it has fallen about $4 million. And again, this is for 2020. So the most optimistic possible result has dropped a bit. The next bar is the medium result, or the most likely, that we presented last month. And if you recall, when we discussed that last month, we said it's slightly more optimistic than the scenario A, which the city had presented back in April. So last month, the most likely was a little bit more optimistic than what we had thought before. But then if you look to the right, that blue bar, now the medium is a little bit below what we had thought in April. So there's a little more pessimism to this forecast than there was last month, and even a little bit more pessimistic than what we saw back in April.
Are those 614s under the blue bar meant to be 714 as in today?
Oh, I'm so sorry. Yes, it is.
Okay, thanks. That helps.
I apologize. Yes, 714. Thank you for that, and that is a mistake. So that is 714. So again, similarly, the low that we presented last month was a little bit higher than our scenario B, or a more pessimistic, and now we're really approaching that scenario B. So we're sort of, this month's iteration is sort of pushing us back toward what we thought in April. I did have Joel Wagner and the budget team and I had a number of conversations with CU over the last 2 weeks, and I talked to Brian again this morning, and he shared that he thinks a number of things are happening. Clearly, we have more actual data or observed values, as he would characterize them. And then a number of other forecast values have changed. So the outlook for a number of the variables that they use in the model have changed. So he thought of note for 2020, why this has pushed down is that the retail trade forecast has declined a little bit. The real GDP forecast has declined a bit. And so that those declines in outlooks are impacting the results. For 2021, if you recall on a previous slides, looks a little more optimistic. And that is largely because the retail outlook has actually improved, as has the real GDP outlook, as well as the employment outlook, he said, has improved a little bit. So it's sort of mixed bag. I think the reality is that the outlook is that things maybe are hitting harder and more now, and it's a little bit improved for the future outlook. So next slide. So we decided to summarize a little bit more in this presentation since it did not change significantly from last month. We're still big picture, remained in the same range of estimated revenue shortfall. When we started proposing ranges, it was in the $30 to $40 million, and then we moved to the $25 to $42 million range. When CU built their model, it actually broadened the range, which I think reflects the uncertainty that we have in front of us. And now the range is sort of similar, $27 to $43 million. So same general range, it just maybe has shifted a little bit. So again, we'll keep an eye on this and monitor it. But again, in our conversations this morning with Brian, he just also wanted to reiterate the tremendous uncertainty that still remains. But of course, we do need to keep an eye on it. And for 2021, we will have to land on a number for our budget, but we will definitely have to be thinking about contingency plans because of the uncertainty. So then the next slide is just another reminder of the next steps that we have ahead of us. We have another one of these council financial updates on August 11th. And then the next 4 items on this timeline relates to the 2021 budget development process. The first important thing on the timeline here is the CIP plan will go to the planning board. And then we have our budget study session with you all on September 8th, and then the readings of the budget to follow. And with that, if you have any questions.
No hands up now. Any questions for Cara or Cheryl? Well, I'm not seeing any hands, folks. You must have done a really great job of presenting, and no one has any uncertainty. So, other than uncertainty about the future. Okay, well, thanks so much, Cara and Cheryl, for that presentation. We look forward to hearing back from you in about a month, and then digging into the budget in the late summer.
Sounds great. Thank you.
Thank you. Jane, I'm going to turn it back to you for our final presentation. Just want to remind council members, this presentation by Kurt is going to be a bit longer than the last two we had. If you could try to hold your questions until the very end. Obviously, if there's something that's super unclear on a slide, feel free to raise your hand or jump in for clarification purposes. If we can ask our questions at the very end, and then Kurt's going to ask us some questions. And then after we exhaust all of that, we do have a very short kind of part B of the presentation that the council members asked for at a meeting last week or the week before. I think will be put on by the legal department. And but let's get through all of the presentation by Kurt first.
Great, thank you, Bob. And indeed, the first presentation, or the main presentation, will be by Kurt Fernhaber. And he is the Director of Housing and Human Services. So Kurt, take it away.
Thank you, Jane, and good evening, council. So before we start, there was a video that we sent out today that was actually completed this morning by some of the volunteers at the COVID Recovery Center, as well as some of the folks at the county. Bob Yates asked, it's because it is so short and so impactful as he saw it, that we show this first and then get on to the presentation. So thank you. So with the technical difficulties, I'll just note for others that this was sent out on Hotline this afternoon, so people can view it there as well. So Sarah, can you bring up our presentation? So I want to first mention who is on the presentation with me, in case the questions go beyond myself and my colleague Vicki Ebner, who's on the presentation tonight. Also from the city, I have Wendy Schwartz, Chief Harold, Allie Rhodes from Parks and Rec, Steve Armstead from OSMP, Judge Cook, Charles Farrell from Planning, and lastly, Greg Harms from the Boulder Shelter. Before I start the presentation, a couple of the council members requested that I address one item. You can probably keep the presentation up, Sarah, unless there's technical difficulties. But let me just start while you're doing that. So before we start, I wanted to give a clarification to the community and council regarding misinformation of the HAB and HRC recommendation to council. It is not uncommon that because of the timing of meetings, a recommendation from a board or commission is not in the council memo and it's presented in other ways. Prior to the joint meeting of the HRC and HAB, we met with the two chairs and indicated that because the council memo was completed and required to be submitted the next morning, any recommendation that came up could be presented by the chairs directly to City Council, and that the council memo would have a link to the recorded meeting. This was also discussed within that meeting. This occurred and the chairs submitted their joint recommendation to you, and we will present that in our slides this evening. However, you have seen that staff have been widely accused of blocking the HRC HAB recommendation. Even the opinion page in the Daily Camera on Sunday stated as if a fact that staff were negligent and neglected to include this recommendation intentionally. Many have also referenced the Tipton report. I would indicate that the Tipton report describes psychological safety of staff. When staff are falsely and publicly accused of actions, this creates a lack of psychological safety for staff. This occurs through the public, through boards and commissions, through opinion pages, and sometimes by council members. For the benefit of the council and the community, I wanted to clearly communicate the circumstances related to the joint recommendation. Thank you. Sarah, if you can move it on to the next slide.
So it only appears to be advancing if we're in presenter mode. I apologize for that, but I can get it to advance this way.
Okay, thank you, Sarah. Well, hopefully our text will be large enough for this. So this is our first slide and our last slide. These are the questions that we're going to be asking you. I'll read through them now, and then we'll address those at the end of the presentation as well. Does council have input on interventions not currently included in the homeless strategy, including sanctioned encampments, safe parking, day shelter, tiny homes, or others? Does council have input on the changes to the homeless programs? Does council have input or feedback on the current balancing of housing resources among vulnerable populations? Does council have input on alignment of the homeless strategy programs with national evidence-based programs and best practices? Next slide. So as we were thinking about this, we've had some new members join the council since we last addressed some of these issues around homelessness. I wanted to give just a very brief history of how we got here. In the season of 2015 and 2016, there were many organizations working in desperate programs, providing services around homelessness. There was very limited data collection around these services and how the impact it had on individuals. And the real focus within the city was really on emergency shelter. Everything sort of evolved around that. And demand for severe weather shelter through BOHO increased. And at the Boulder shelter, the number of turnaways that we had on a nightly basis increased each year until this season. With those challenges, City Council directed a working group to work on this, come up with a strategy. We worked for many months on this with the community as well as the service providers. It was facilitated by the Corporation for Supportive Housing. That evolved into the strategy which we have today, which was approved by council almost 3 years ago. It's still a relatively new strategy that's evolving. But after that strategy was approved, there was also a collaboration that occurred between Boulder County and the city of Longmont and the housing authorities to really work together as a regional approach. And these two things have really worked closely to guide the work that we've been doing over the last 3 years. A data system was created for the county, by the county, where all service providers use this data system. It enables us to have things like dashboards that we didn't have before. It's the backbone for coordinated entry as well. This also helps us understand the funding and coordinating our funding between agencies, as well as maximizing that partnership to bring in new funding. Everything we did at that point, the focus was aligning with the Housing First strategy. Really focusing on housing solutions. Next slide, Sarah. I'm going to pass it to Vicki for the next 2 slides. Vicki, you may be muted.
I was. My computer decided to be ornery. I'm sorry. Good evening. We thought it might be helpful to review some of the key terms and the programs that are in the current system. So starting with coordinated entry, it's really the front door of our Boulder County system. So it's where people come to get screened, to get referred to different or particular programs, depending on their ability to divert. They can also be sent to our navigation program and our housing focused shelter. We do look at their Boulder County residency and some of the barriers such as disabling conditions at that time. Excuse me, diversion services are based on a national model. And this is our newest program. It started at the beginning of February. And I will say that while it is based on a national model, some models do vary in the populations that they serve. So it is sort of hard to compare how the different programs are set together. But with diversion, the goal is to have people not ever enter into our sheltering system. So if we can address someone's crisis through a small financial contribution or a landlord negotiation, it's going to be more effective in the long run. And as this is an only option for some people who don't really have Boulder ties, the most often use of this program is reunification with families or friends or support systems. And I want to be clear that that's not just paying for a one-way ticket out of town. The diversion services worker works really closely with the client and the connection on the other side to make sure that there is that connection. So for example, if somebody wanted to go to California because they heard it was a great opportunity, but they didn't have a support system or anything set there, the diversion program would not support that. Navigation differs from diversion basically in its structure. First, there's sheltering that's associated with the case management services that are provided under this program. And as these are people who couldn't be diverted, you start with diversion, and if you can't be diverted, you move to a different program. They need a little longer to resolve their issues. And so while reunification may still occur, navigation interventions range all over the place. They can be people who need help with security deposits while they're saving money to make that first rent month. It could be ready to work or treatment programs or any other kind of different interventions that we can provide them. Moving on to permanent housing, this is generally speaking housing that is safe, decent, and stable. So within permanent housing, there are 2 subsets of housing interventions that would fall under this primarily. And that's going to be permanent supportive housing and rapid rehousing. Permanent supportive housing is tailored to the most vulnerable or the most chronically homeless. And it provides rental assistance with addition to really intensive case management services. The difference with a rapid rehousing program is that rapid rehousing is a time-limited program. And so the case management focus for permanent supportive housing is all about being a good tenant and helping to achieve some life goals. Rapid rehousing case management is focused on self-sufficiency and making sure that they can support the rent once this assistance ends. One other note I would make about permanent housing is that HUD characterizes things like tents, shelters, or cars as places not meant for human habitation, or shelters, I should say, and they are not considered permanent housing. Next slide, please. So this is somewhat of a complicated slide, but one of the things we look at when we're looking at the types of housing and the types of interventions that we want to provide people is meeting them where they are and figuring out where they need to be. So if you look at the green boxes, those are exit interventions, as opposed to the purple boxes, which are programs and services. As we move along from left to right on the spectrum of where somebody falls under homelessness, our resource is going to be higher and our case management services are going to be more intensive. And those are reflected in those blue bars. COVID has provided us some challenges. And I want everybody to know that we have been planning all through this pandemic as to any kind of future activities that we need, housing resources or program resources that we will require. And we've been working very closely with our state and regional partners for additional funding, and where any proposed changes that have been coming through either of those entities would disproportionately impact our homeless population, we've been talking to them about ways that we can make that better tailored to Boulder. One of the challenges, quite frankly, is that our services that we've provided for our COVID population have worked. While we know that that could change on a dime, right now, the low number of people that we have had that have been sick or that are currently at high risk have meant that we don't have hundreds and hundreds of people in shelters or in hotels that are at higher risk. And that can be a challenge when we're talking about state or regional responses to housing resources. We've already prioritized in our ongoing methods for set-asides and City of Boulder vouchers really towards people who are elderly or have some common COVID risk factors. One of the other areas that's warranting monitoring and planning considerations for people who are homeless following the economic upturns includes, making sure that we understand that that's going to really primarily impact us at prevention, diversion, and navigation. And there are already a lot of community resources that are out there to try to help people before they ever really get on this chart, which we'll talk about later in the presentation. And we did increase our estimates for navigation services, because if there is somebody who moves from an eviction to homelessness in the adult system, they're likely to be moving towards a navigation program. And I'm going to switch back over to Kurt at that point.
Okay, next slide, please, Sarah. So I'm going to talk about some of the changes that have occurred this year, and I'm going to go on to talk in particular about the changes that have happened in 2020 related to COVID. But in February, there was some changes to our program which occurred. We went from a 1-month residency program to a 6-month residency program for housing programs. And there was concern both in the city of Boulder as well as Longmont about resources being diverted from people who were part of our community, and that they didn't have sometimes the same opportunities for assistance as those that were new to the community. So we went through quite a lengthy period of time to consider that and look at that through through our system. The diversion system the diversion program, as Vicki talked about, was implemented right at the end of January or the 1st of February. And so that also led to a reduction in navigation, because navigation was the program that really took all of those individuals who needed that service. Now we've targeted into 2 different services. And it's I'd like to remind us that these services are not just in Boulder, but they're in Longmont as well. And the decrease in navigation was really seems to be as the result of three things. One is the implementation of the diversion program. One is the 6-month residency, and one is the number of months in this spring where a severe weather shelter was open each night. And we saw that some individuals came out of services in order to just use severe weather shelter. On the right, you'll see our coordinated entry in 2020, what it looks like from month to month, and for the length of time of individuals who had ties to our community or not, and how long they had been in our community. So you'll see the green, which is the 1 month. That's the largest number of individuals basically in every month that we run coordinated entry. Next slide. So severe weather shelter, one of the things we'll be discussing tonight is the changes in severe weather shelter over this year in its location and the closing of 30th Street. And what we're looking at here is the reduction on a month-by-month basis at the North Boulder shelter of individuals that are staying there and using beds in the housing-focused shelter. And we've had a really aggressive push to get individuals housed, and even through this COVID environment. So you can see it ranges from -3 down to 37% reduction in the number of individuals needing beds at the shelter. And this is comparing from, each month is comparing the month a year ago. Next slide. So this is one that Aaron Brockett requested, and which we had prepared earlier, really looking at what the forecast looks like. So I first want to start with that gray bar that says Boulder Shelter for the Homeless building capacity. And the reason it's a very wide bar is because it's a range. And the range is between 140 and 155 beds. The Boulder Shelter has been meeting with public health and getting advice on what full capacity looks like, how they can rearrange things, and which beds should come and go. So this is the range that they have right now. So if you look at June and July, August, those are, well, June is actual, but those are projections based, so the green is housing focused shelter, which is been the main component at the shelter. You know that navigation moved over there a couple months ago. That's in the orange. The red is the COVID recovery center, and that will be running through next spring. And then you can see the blue, which is severe weather shelter, which is probably the most critical aspect of this graph. What it shows is there would be capacity anywhere from 26 to 67 beds for a severe weather shelter based on the month. On top of that, however, we have a trigger for hotels. We've been using hotel rooms for the past about 3.5 months for individuals that have been at high risk to potentially, if they got COVID, if they became COVID positive, they would struggle either because of age or health conditions. So they've been taken out of the congregate care system and put into hotels. That isn't running currently from July forward, and that can be triggered as the season or the COVID situation changes. And then on top of that, you can see the COVID recovery center. So there's a bit of variance within this estimate. The blue represents what we believe is our sort of our worst case scenario on the number of beds available for severe weather shelter. Next slide. So this is to show the activities and the changes that have occurred since the middle of March, and there are many. The homeless system has been, and the changes to the homeless system have been ongoing through conversations with our regional team, with the county and Longmont, with public health, and with the service providers. So on the 16th of March, the first thing that we implemented was CDC guidelines for the shelters. And that had an impact on both 30th Street and the North Boulder shelter in separating beds. Navigation moved to the Boulder shelter for the homeless for a period of time. And then on 4 days later, I think the 16th was on a Monday, on that Friday, the 20th, the COVID Recovery Center opened at the East Boulder Community Center. And from that night forward until tonight, every homeless individual that accesses services in our county goes through a screening. And if they screen with COVID symptoms, they're immediately transported to the COVID Recovery Center. So then dates on a week and a half later, day services were opened at 30th Street. Severe weather shelter was no longer triggered by weather. It was open every evening. We also started distributing water, both at 30th Street and at the North Boulder shelter. And then I was quite relieved that we were able to appoint a manager for the COVID Recovery Center at that time as well. Clinica on the 10th, so we've been open for about 3 weeks, started testing individuals at the CRC. And we also started providing thermometers on the 17th to the HOT team so they could also start doing symptom testing out in the field. On the 1st of May, the Boulder shelter had a positive individual in the shelter, and they were concerned, reached out to public health, and they reduced their bed capacity to 90. I also missed that there was a mass distribution that occurred in April as well. Then on the 1st of June, the Boulder Shelter for the Homeless started opening 7 days a week to provide services for any homeless individual in our community for showers and breakfast. This is a result of, or many of these steps are a result of having many of our buildings and services closed in the city. Navigation transitioned to the Boulder shelter on that day. Boulder shelter capacity was increased to 100. On the 12th of June, we moved the COVID Recovery Center to the Mount Calvary, the former Mount Calvary Lutheran Church in South Boulder. That was to enable the rec center to start opening up and using that facility. It's planned for that to be open until March next year, and it's owned by Boulder Housing Partners. And then on the 22nd of June, through coordination with public health, we started testing, a process for testing every homeless individual that enters into services, or offering that testing to them. I believe we've tested about 120 individuals in Boulder. They're now testing in Longmont as well. The good news through all of these steps and interventions is that we did not have one individual who tested positive or asymptomatic. We were quite relieved by that outcome. So over the next couple of months, we're going to be monitoring the shelter needs, prioritizing permanent supportive housing placements. That's really our strong push right now, and ensuring that the COVID Recovery Center is ready for new positives that may come into the system. We will continue to screen individuals on a daily basis to ensure that they stay out of congregate care. Next slide. So this is a a table which shows the different programs and the number of individuals that were using overnight shelter. And you'll see at the bottom is the red, the COVID Recovery Center. It doesn't include individuals that came from Longmont. And then housing focused shelter. You can see there's a downward trend in that. And those are individuals staying at the North Boulder shelter. Boulder navigation in the purple. And you know, that's ticked back up in June, which we're I'm pleased to see. There's overflow and diversion. Those are individuals that would have gone from 30th Street to the shelter for capacity reasons. Severe weather shelter, you can see that shut down at the end of May. And then on top is the yellow, which is our hotels. So this will give you a rough idea of sort of the breakout of how these various programs fit into the various bed capacity within the city. Next slide. So a little overview on the CRC residency and results. This was a program that we opened very quickly. It opened 7 days after we put forward the idea. The initiative was really to get ahead of COVID within this community, which we really felt was at risk. So some of the things that have occurred, we've provided assistance to other cities as well. We've had a number of Front Range cities that have visited the CRC. That was primarily in the first month when various communities were trying to figure out what to do. The State Department of Housing listed it as a best practice. And the CDC did a tour of the facility, and they also had us review their policies for this type of service. That was done about a month ago. We've had, at the point that we started testing, we've had 8 people test positive. 5 of those were from health facilities. Over 4,500 hours of volunteer hours. So to look at the impact of this intervention, I think it's important to realize that the city of Denver, if we use that as a comparison, has 6.5 times more homeless individuals or in their city than we do in Boulder. And they have 57 times more positive homeless individuals. And many of those have passed away as well. So I think it's a great data point to look at the efforts of Bridge House, the shelter, our shelters in Longmont, and the CRC. Next slide. And I will let Vicki take over from this point.
So when we start talking about how the city addresses homelessness, it really runs across several city budgets. It includes departments such as Parks and Recreation, Municipal Court, Open Space and Mountain Parks, Police, and Transportation. But if you look specifically at the Housing and Human Services budget, we put in about $4 million annually to address homelessness needs. In the adult homelessness budget, it's a little over $2 million, and that breaks out almost half and half between service and supplies and housing. These numbers also don't include any kind of staffing costs. The affordable housing that has been dedicated for permanent supportive housing in 2020 really ratcheted up, and we're estimating that at approximately $1.2 million. There's an additional $800,000 that goes towards family or youth homelessness or prevention. One of the other important aspects of our budget is that it's very much leveraged with the regional partners in the city of Longmont, so that we can really effectively address their needs. So for example, our local housing authorities decided to set aside 20% of all affordable housing that could be used for permanent supportive housing. And we were able to match that rental assistance with a case manager provided through the SAMHSA grant. And SAMHSA stands for Substance Abuse and Mental Health Services Administration. That grant is actually administered by Boulder County. And so that was able to be mixed in, and that provides us more opportunities for vouchers. Another example would be where our local permanent supportive housing funding that the council approved in this last budget can help us target some people that maybe don't rise to the top of the 7 county regional prioritization for permanent supportive housing. And that is really important because then it lets us really meet the needs of some of the people who are very vulnerable in our community, but maybe not quite as vulnerable. And we can really be strategic on how we share those resources and how we make everything work the best it can. I will say that on the budget side, you know, it does not include things like the numbers I showed, like as I mentioned, are only for Housing and Human Services. So this doesn't include the 1.5 people that are dedicated at the municipal court for homeless navigation, or the 2-person homeless outreach team in the police department, or any of the expenses that go with trash or hazardous material. Next slide, please. So with severe weather shelter, as you're very much aware, you adopted at the end of January to have severe weather shelter run every night, regardless of weather, up through March 31st. And then because of COVID, it was extended through May 31st for every night sheltering. For the upcoming season, we are recommending a return to weather-related triggers. Really, this is because our 2 factors. One is budgeting and resourcing, but the other is really about the need to maintain our resourcing to ensure that we have something that is sustainable and is able to continue. And at the same time, helping people either self-resolve or move towards one of our programs. As you can see from the chart on the right, a high number of people who use severe weather shelter are newer to the community. And I say that it may not be as clear as possible on this chart for you to make that connection. So I'll try to talk through that. Between January 1st, 2019 and May 31st, 2020, about 53% of the people who used our severe weather shelter actually had engaged with, were new members of our coordinated entry group. As we've seen in other slides, 2/3 to 75% of the people who come through CE during 2019 were people who are newer to the community. Another important note about this particular group of people who did go through CE, they were almost to a 1. It's 91% of them were referred to one of the 2 Boulder shelters, and the lion's share of those being people who were referred to path to home referrals. Keep in mind, these are referrals. It does not reflect whether people actually use those services or not. The median night usage was only 4 nights. And while there are some people who use severe weather shelter for many nights, the vast majority of them only use this space periodically. As I mentioned, budget is a constraint. In order to run severe weather shelter at the 38th Street location, to put that back into place, we estimate that would be somewhere between $500,000 and $600,000 based on our lease costs and the cost that it would take to staff and run that facility. As we shown earlier, BSH can hold somewhere between 25 and 50 people per night running severe weather shelter at their location. I do need to point out that that is a reduction from this past season. Next slide. I mentioned a couple of times that our municipal court and our homeless outreach teams are very important members of our approach to ending homelessness. The municipal court and the police homeless outreach team work with some of the most challenging clients. These are people who are sex offenders, significant substance abusers, people who have severe mental health conditions, and people who have frequent incarceration. Even as they are incredibly challenging people to work with, our municipal court team and our HOT team, who work together on some of these really challenging cases, have really been able to push the needle on some of the people who are some of the highest users of our judicial system. So the chart on the right will show you that there were 84 people that the Municipal Court Navigation Program have helped assist with housing. And assist with housing sounds a little weaker from what they actually do. They're very involved in making sure that people make it all the way through that process. And in some cases, but for those two teams of people, these people would not be able to successfully house. Another important piece of that is that over half of the people that they did assist with housing are people that are considered high utilizers of the municipal court system, or basically people who have more than 20 cases to their credit. The challenges still exist. We'll talk a little bit later about meth addiction and criminal histories and how those can be barriers to getting people into housing. So we are still working through different responses and making sure that we have different ways to make sure that we can accommodate those needs. The other thing I would say is that our HOT team, or our homeless outreach team, have really strong relationships with a lot of the people who are experiencing unsheltered homelessness. And they have been very instrumental in moving that needle. They're non-enforcement, but there are certain activities that they provide that being part of the police department actually helps them do their work with high utilizers of that justice system. One of the really important pieces is that through their efforts, we actually help keep people out of the court system. Next slide. One of the things that we wanted to look at was the comparison of how we are doing as a system. So when you try to benchmark, this becomes particularly difficult because there are few cities that actually report on their exit rates or their program successes. As Cart mentioned at the very beginning of this presentation, this was one of the benefits we had of setting up the Boulder County Connect system through the Boulder County as part of the HSBC. But there are a few communities that do measure and report on this information. And so what we have found at a very low level of information, unfortunately, cities like Santa Cruz, California are housing about 11% of their active homeless population. And the county that contains Ann Arbor, Michigan is running at about 20%. One of the things that shows that we are or HSBC is really a learning system and we're trying to figure out how to correctly resource is the fact that a comparison of the people coming into our system and the people coming out of our system, our rate for getting people out of the homeless system is actually increasing as the years go by. So we've moved from 15% of the first year of HSBC to 28% in 2019. And so far, January through April, we're running at about 33%. Next slide. So specifically looking at exits, we spend a lot of time talking about permanent supportive housing, and this is really because it's the most intensive resource and quite frankly, the most expensive resource. But that's not to say that there aren't other types of exits to homelessness or from homelessness. So we break them in broad categories: housing, reunification, referral to other programs or treatment. And then we do leave diversion as its own separate category. And that is really a function. It can be housing, it can be reunification, but because it is a specific program, we do keep it separate. So as you can see, even with COVID, we've had some pretty good responses on our homelessness throughout the different types. I will say that housing is not just PSH in this chart. So the blue bar includes everything from permanent supportive housing to rapid rehousing, one-time assistance, short-term assistance, or any of those things that relate to somebody being able to obtain housing. Some people are referred to treatment programs when that's needed, and those can include detoxification or long-term psychiatric help. Next slide. So what we tried to show here is really how we offer our systems through a continuum of both Boulder County residency, but also their level of engagement. So if somebody is disengaged, then it is going to be incredibly difficult to help them achieve an exit from homelessness. And so really a lot of effort goes into moving people from the right hand of this chart to the left hand of this chart. And that includes efforts from the homeless outreach team, other types of outreach that are out there in the community, our sheltering systems, our municipal court navigator, and then to some extent our severe weather shelter. While it is used by people who are both engaged and disengaged, generally these are people who are not engaged with our service systems. So whenever we have the opportunity and somebody does qualify, we want to try to move them over to and encourage them to work with the different services that we provide. Obviously, somebody who has been in Boulder County for a long time and is very willing and able to work on solving their problem and getting help, there are a lot of different options that are open to them depending on what their needs are. And those are all the purple bubbles listed in the top left-hand corner of this chart. People who do not have ties to Boulder County, obviously resourcing is a little bit more limited. And however, if you are engaged and willing to work with us, then we do have diversion services that are available and some outreach services that we will talk about in a minute that are encouraging to help you figure out how to connect to whatever resources you may need. For example, mental health services or some other non-sheltering type services. Next slide. So I think we all know that homelessness is ongoing and evolving, and it is not a perfect world. And while we've made great strides, there are still some areas that are challenging for us, and there are some areas that we're looking at as areas of activity or things that we're investigating. So we are monitoring all of the changes that we've made today, or that we've talked about, that we have made, and looking at have they worked, what needs to be tweaked, and moving forward from there. One of the core components of the HSB system is that we can collect coordinated data and we can work collaboratively to make those adjustments based on that data and that evidence. And we'll continue to focus strongly on creating housing opportunities. And really that's the bedrock of our success, is what sets us apart from other communities, is that collaboration and that working together with people who bring a lot of experience into the mix. In addition, we've highlighted a few ongoing challenges that we are working with our partners on. The right housing opportunities for people with meth addiction. This is extremely challenging, both from a housing standpoint and a treatment perspective. We're looking at increasing the level of data sharing across our organizations to impact our housing for high system utilizers. So not just our justice system, but also hospitals, jails, veteran services, law enforcement, and other community impacts. We are continuing to address encampments through increased departmental coordination, and we're building on the successful work we've done so far with our CRC and our screening processes to make sure that we're keeping people safe during the pandemic, as well as planning for their housing and sheltering after the pandemic. Next slide. So one of the things I mentioned is a major challenge is substance abuse or substance use and addiction. So addiction and mental health are certainly correlated with homelessness and can create challenges as we work to exit people through homelessness. As with many things, COVID is creating some challenges there. And so many of the services that are currently provided in the system have moved to an online or telehealth option. It's not optimal. They've made it work the best they can, and this is slowly reverting back to in-person services. Meth addiction is the most challenging aspect of mental health because there aren't any tested treatment options, and meth usage is in multifamily residences create a broader public health problem, and therefore our landlords are not easily going to allow people with active addictions or significant criminal history related to meth into their apartments. So HSBC, or Housing Solutions for Boulder County, has really been exploring some housing specific for people with meth addictions. And they've been in conversations with the successful nonprofit in Denver to see how we can maybe bring some of those types of services into Boulder successfully. One of the other things I wanted to comment on is the EDGE program. The EDGE program is a partnership between the police department and the mental health partners. And mental health professionals assist with on-site mental health crisis situations. Basically, an EDGE encounter is when there's a police officer and the client agrees to the help, and a co-responder from mental health joins the conversation to try to de-escalate the crisis. One thing that's important to note is that EDGE is not a homelessness service. It's a mental health crisis service. In fact, between January and July of 2020, obviously July is not finished yet, so that would be a to-date number. 47% of those encounters have occurred in a residence of a client. So there's a handful of other people that are not in these two categories, but then another 42% of those are just listed as other places of service, and that may or may not mean that they are without a house. Next slide, please. So kind of switching gears and starting to talk about how we evaluate kinds of system changes that need to occur. The core guiding goal of HSBC is housing, and that's part of a national strategy called Housing First. And Housing First doesn't mean housing only, but it does mean that you focus on getting a person into housing as quickly as possible and deal with their other issues after you get them housed. You're not trying to solve their drug problem before they get into housing, and you're not trying to wait till they get a job. Because of all of these problems are certainly more manageable once you have a stable housing. So when we're in HSBC, we look at new programs and other changes that we need to make, and we really look hard to see how each of those changes would help people further into getting into housing. Another thing we look at is how does it align with the city's overall homelessness strategy and HSBC goals? We look at how the changes align with data and evidence in the community and nationally. We really want to invest in things that have evidence that supports how they'll work, makes sense of what trends we're seeing, anything that we can look at for benchmarking against national best practices. And I will say that our data is not perfect, but it is better than what we used to have, and certainly better than what most communities have. The other thing we want to look at is, are changes cost effective? When we look at the results we want to see and where the innovations fit into priorities, are they going to be reasonable? If we're spending money on something, we're going to make sure that that is going to meet those overall goals in a reasonable and responsible manner. And then finally, what we want to do is we're not going to be able to solve homelessness for everybody that may want to come to Boulder. And so we have to really look at how we prioritize services and housing for those people who are currently living in Boulder County. And we do want to make sure that they have been in Boulder County for 6 months or more, is how we define Boulder County residency among the unhoused. Next slide. Another thing we look at when we're making changes is really the overall community context. There's a broader context that we have to consider when we're looking at adults experiencing homelessness. We have to look at families that are experiencing homelessness and our lower income residents and the services that they need, so that we aren't creating a situation where we're creating more people experiencing homelessness. It is much easier to help somebody avoid homelessness than it is to help somebody once they have become homeless. We have about 7,200 people in the city who live below the federal poverty line. And that's about $25,000 for a family of 4. We did exclude the number of people that are likely to be CU students because they would not be actually living in housing instability or poverty. We do a lot of work with the community partners to make sure that households living in poverty are supported on a regular basis. And we've expedited about $500,000 to partners during COVID to help people with basic needs like rent and food. But as we evaluate some of the other things that the city might invest in for adults experiencing homelessness, it's important to keep in mind that other people might need help too, including people who are at the edge of housing stability and people we don't want to fall into homelessness. So as the pandemic continues, no one knows how many people in the community are going to end up needing more than the federal stimulus programs or payments that assistance wants. But we do have some information that's included in this slide that kind of talks through some of those trade-offs for potential investments. So, for example, we mentioned earlier that an additional severe weather shelter could cost approximately $500,000 on the low end. And that is really equivalent to helping another 330 households with rent for 3 months in some of our programs. You know, there is a pretty strong backbone of preventative services that have been put in place that factor in all these situations. But again, there's only so much planning we can do, and we have to be responsive to a broader need. Next slide, please. So one of the things that I'm fairly proud of that I would like to talk to you about is something that we're proposing to put in place. And that's the Boulder Targeted Homeless Outreach and Referral Effort. And that's acronymed is Be There. And that's it's a program, we're proposing this as a pilot to increase our outreach and engagement in key Boulder locations. And what we want to do is we want to make this the first line of engagement with people experiencing homelessness and help connect them to their resources and compliance with existing ordinances. So not only are we trying to get them to go through CE or work through some of the other services, but we also want to make sure that they understand not only public health orders, making sure they have masks. Our goal is to have masks that can be passed out, do health screenings, but also just in general, increase the knowledge of what is allowed and not allowed in our public spaces. The idea would be that this would be a 3-person management team or engagement team made up of a mental health professional, 1 person with lived experience, and 1 person with homeless outreach or services experience. One of the things that really makes this exciting is that it's a multi-generational and a cross-disciplinary approach. And it's really meant to augment the existing outreach efforts that are being done by the homeless outreach team. Right now, we're still working with a couple of nonprofits to get this developed. And our budget estimates are really set to evenly disperse that between the nonprofits, the city of Boulder, and hopefully be able to access part of a grant that the county has. So while this is something that we really feel is needed in the community, it is still at the exploratory phase. Next comment, please. So we are looking at some different topics that council advised us to look at during the retreat. So you asked us to look specifically at encampments, safe parking, and tiny homes. One of the things I would preface with our conversation, and I know that you have the memo that has a lot of our benchmarking that was done with different programs, and you've received a lot of communication about different programs that are out there. What we're looking at is how they are designed, what are the considerations that need to be made to that end, Staff does not feel that we can support safe parking or encampment setups in our current environment. With tiny homes, there are some considerations that could be made that might make that work, and Kurt will talk about those a little bit later. But generally, what we're looking at is there are some factors that have to be considered. And so what hasn't really been fully fleshed out are, how these programs would be administered, the security and police and trash collection issues that would come up, the cost to the city and or county for these types of programs, how those trade off in that broader community context, policies that need to be put into place, everything from how long somebody can stay there, what are their requirements for behavior, how do we ensure who can stay there? Is it only adults? Can children be there, et cetera? Looking at the coordination with systems and housing exits, how do they fit in with a coordinated entry policy? What are the residency requirements? Is it going to be open across for anybody experiencing unsheltered homelessness? How we work with, if any of those programs are set up, how we would work within existing housing prioritization mechanisms, and how do we bridge them into housing? Evidence and success that the programs that are being proposed show in getting people into housing is an important criteria. And then last but not least, the location, the siting, and the neighborhood considerations that have to be made. So questions of density, available land, how the neighbors are going to feel about this. Is that going to put an undue impact as to neighborhood safety? One of the other things that I think is really important that we look at is our participant safety. A lot of these camping type programs are usually done in more temperate climates. And having lived in Colorado for a whole whopping year and a half now, I can tell you it gets cold here. And that it can be a little bit more dangerous situation. So all of those things go into how we made those recommendations. And with that, I'm going to turn back over to Kurt so he can kind of go through a little bit more specifically on some of those recommendations.
Thank you, Vicki. So we're on the final run now. Just a couple more slides. Can you go to the next slide, Sarah? So before I go through the HAB HRC recommendations, we spent a lot of time looking at the information that was presented at HAB on that evening, and then following information that was sent by both community members and HAB members. As far as encampments, so these are the recommendations, and I'll go through each of them. Those that are in black lettering, we don't recommend. Those in green, we support. And those in orange, I think we've got some overlap of support with some caveats. So in the research that we looked at, particularly around encampments, one of the pieces of information that was sent to us by Mr. O'Connor was from 2010. And it talked about camping at a cost of $1 a day. We looked at that budget. It didn't include land, security, case management, admin, and supplies. So we would want to consider those things when looking at this. Judy Nogg sent some very good articles around tiny homes, and I'll just address that quickly as well. Tiny homes, from my experience in developing co-housing, I think are a great community solution for housing. The concern I had in comparing the other communities that have done tiny homes is they have plots of land which are much bigger than what we have in in Boulder. One of the ones that was referenced was over 50 acres. The others are, 3 to 5 acres. And most of our developable land in the city of Boulder around affordable housing is anywhere from a half acre to an acre or two. It's difficult to get a lot of development out of those through that kind of density. But the cost for tiny home is the information that Judy had sent through was about $14,000 per year, which includes case management. In Boulder, we pay about $18,000 for that same service through our current program. I think the difference between tiny homes in Seattle and Boulder is first of all, our land costs are a bit higher than the areas identified for those tiny homes in Washington. But more importantly, our fees are higher. We require foundations. We have regulations around requiring radon mitigation. Every residence requires sprinkler systems. In Boulder, the way we look at it, it costs $60,000 to create an affordable unit or a residential unit before you've actually done anything. And so I think the cost differences would be fairly significant in Boulder. Every once in a while, we get a piece of land where it seems like it would make sense for tiny homes. A year and a half ago, I thought that Hogan Pancoast would be that location. The council went in a different direction than that. But that's the kind of land and the size of land that really makes sense for that type of development. The investigating hotels, we do use hotels, as we've mentioned earlier, but not as far as purchasing hotels. However, they talk about, the recommendation also talks about, converting different buildings into affordable housing. We fully support that. In fact, currently, there's a sports club that's being in our community that's being rebuilt into affordable housing. There's a church that's being rebuilt into affordable housing. So I think we're on board with that component. Immediately find a way to restore path to home with Bridge House. I would have pretty strong concerns about this one. That was a competitive process. We're required to go through a competitive process for all such contracts. This is actually, in a lot of our contracts, or most of our contracts are actually done through the county. And for me to interrupt a competitive process to give it to another organization that didn't compete for it would probably be the last thing I would do as an employee of the city. And so I'm concerned about us being directed around procurement. An oversight committee, I think the challenge there is that these contracts are actually adjudicated through the county because they're county initiatives that we contribute towards. Having a city oversight committee for coordinated entry, which is done throughout the county, I think would be challenging. We do definitely agree and support their idea around having individuals with lived experience have a more active role in policy and program development. The dashboard that hasn't been updated since February. It was updated, I think, yesterday. There's two reasons for that. One, as we increased included a new program of diversion in the end of January, it required further development. And when COVID hit, one of our data individuals was furloughed, and the other was basically running our CRC volunteer component. We just simply haven't had the capacity. They want it updated every 30 days. We fully support that. The HOT team, Vicki talked about that. The integration that they have with the courts is a critical aspect to their work. That's certainly a discussion we're willing to have, but I think the discussion needs to occur before a direction is given. Educate the public on issues related to the unhoused. We fully support that. That's why we have things like the dashboard and the annual reports. Creative financing. We believe that the private entities and nonprofits in our organization need to continue to play a role in this, and we support that. Integrate the 2020 Unhoused Vision Plan with countywide initiatives. We wouldn't support that, and we support the strategy that the community was involved with in developing that we're currently moving forward with. Next slide. So another group that put some ideas forward in our community, Safer Boulder. And I'll start off by saying this was a difficult one to put colors to. It's sometimes hard to understand what's behind the words. Fully enforcing the urban camping ban, we support that. It's our view that a successful program without enforcing the camping ban is not going to be effective. And most importantly, it creates safety for individuals. The housing outreach team, they're supporting that. We also support that. Increased police patrols. I don't speak for the police department, so I'm not going to give input around that. However, what we agree on is that there needs to be more engagement within the community or out in the community with individuals. So better protecting our business community, obviously we support that. However, categorizing homeless individuals as criminals, we didn't really support the way that that was portrayed. Hear public concerns in response to accountability of citizens. We absolutely support that. Next slide. So I'm sorry that took a long time. There was a lot of information and several council members asked for more things, so it got longer over the last couple of days. But I'd like to circle back to these 4 questions, but I'll hand it over to you, Bob, and you can manage the process from here.
Well, thanks, Kurt and Vicki. That was a great presentation and well worth the time that it took. Before we answer Kurt's questions, let's ask questions of Kurt and Vicki and Wendy. And I want to remind council members that we also have available to answer questions Greg Harms from the Executive Director of the Boulder Shelter, Judy Nogg from the Housing Advisory Board, and Lindsay Loberg from the Human Relations Commission. And so if you guys would raise your hands, well, let's get through all of our questions, exhaust our questions, and then we'll turn to the questions the staff is asking of us. So I've got so far Aaron and then Mark. Aaron?
Yep. Thanks so much, Kurt and Vicki, for the presentation and for the extraordinary work that you and the rest of the staff have been doing for a long time, but particularly during the COVID crisis. The standing up of the CRC was an extraordinary accomplishment. And also all the housing exits have been incredibly impressive. So before I go any further, just wanted to thank you for all the successes that the city and its partners have made.
Thank you.
Absolutely. So a couple just detailed questions. Many slides back, there was one about exits. There was a bar chart about how many exits there were and what kinds of exits there were. And in one section, one of those types of exits was reunification. And then another type, which only started happening more recently, is diversion. Can you explain what diversion as an exit means? Because I had thought that pretty much meant some kind of form of reunification if diversion was successful.
Vicki, I'll let you go with that one.
Sure. So primarily diversion is reunification. However, it could be other things such as paying for somebody's car repair bill, or it could be even in the case of somebody who has been in the community for a while, might be non-financial, where it could be negotiating with the landlord to keep them in, to let them come back into a living situation. Because it is so broad and it's a little bit more light touch, we kept it as a separate category of reporting.
Okay,
Aaron,
yeah,
if I
go
could
ahead.
also add, it is a new program, so we wanted to keep it separate. But just for clarification, as far as a car repair, that's like to help someone get to their job so they can stay in their housing. It's not so they can stay in their car.
Thanks. Yeah. So, but the point would be that in all of those cases that they were either housed or kept in, housing. Is that correct? So that all of those people that you record with those exits have housing at the end of that exit. Is that fair?
That's correct.
Great. And Kurt, you had the chart of expected beds and resources available, which I appreciate you doing that. My question that I had posed over Hotline last night had another component as well, which was how those numbers compare to the numbers that we've had over the last couple of years. And that I did not see in the presentation. So kind of off the cuff, or would you be able to summarize that?
Yes, so I'm just adding them up right now so I make sure I get it right. So last year, and Vicki, correct me if I'm wrong, I think we had 282 beds. We had 160 at the shelter, 72 in severe weather shelter, and 50 in the navigation program. With the so the range that we presented is somewhere between about 160 and 170 or 175 in that area, if you include the CRC as well as the hotels. So it's a drop of a little over 100 beds.
Okay. Yeah, thanks for explaining that. And then and Kurt, you and I talked about this some earlier today, but just so that we're talking over in the meeting. So that's a significant reduction. And so the severe weather shelter component of the plan, as I recall, the slide had about 30 beds available. And because I think you went to some larger numbers, but that was in May, which I don't think is terribly relevant, right? So do you think it'd be fair to characterize it as about 30 beds over the course of the winter season?
Yes, I would say that is correct. So I think
well, if I can just finish that.
Sure, sorry.
So then my concern is that's a much smaller number than we've had in the past. And it seems like that may well have capacity problems, and that there maybe with severe weather events that it may not be sufficient. And so what are we going to do if there's a big blizzard and there's 30 severe weather shelter beds, but there's 60 people that need to come out of the cold that night?
Sure. Well, let me first talk about some of the proactive steps that need to be taken. So if I can give the example in the change from the seasons from 2016 to 2017, that's when we went from the O to the 30th Street location. And so we went from having programs that were open every night without restrictions to having restrictions on weather conditions. And those weather conditions were 20 degrees and 32 with precipitation. So there was obviously a lot of communication at that time with the homeless community, particularly through the fall. And as we've gotten more individuals housed within our community, the percentage of individuals who are homeless in our community do not have ties to the community. And so communicating with them about where they're going to be staying for the winter is critically important. When that seasonal change happened, we reduced the number, on average, the number of individuals that used severe weather shelter from one season to the next by 100. For the highest and peak period, it was 50 beds or 50 individuals. So we've seen that homeless individuals using the services do manage based on the availability of services. So it will behoove us to be very clear on our communication with individuals about what the actual capacity is. I think all of us share the concern around capacity, particularly in this first year in this transition. The other proactive step that we'll do is we'll continue to look at lowering the number of individuals who are using the shelter, waiting in the housing queue and getting them into housing between now and the end of the year to create even more capacity for severe weather shelter. What we also saw in the change of season from 2016 to 2017, we had a number of, that's the year that we had the largest capacity within our community for severe weather shelter. It's also the year that we had the largest number of individuals that we had to turn away as a capacity problem. We didn't have that issue in 2017, even though we had a much lower capacity. So I think our proactive steps are incredibly important. I think we share your concern, and we'll have to make sure that we do those steps correctly over the next few months to prevent us from being in that situation.
Okay, well, so thanks for that explanation, but that's about, you know, how we're going to hopefully avoid not having enough capacity. But, you know, we may, regardless of those efforts, end up in a situation where we don't have enough capacity. So do we have a sort of a backup overflow plan at this point?
We do not have a backup plan for that.
Okay, well, thanks. And when we get to comments, I'll talk about that a little bit more, but appreciate the answers.
Great, thanks, Aaron. We got Mark, followed by Mary, followed by Adam. Mark?
Yeah, Kurt, thank you very much for that presentation. I thought it was terrific. My questions are also detailed questions. On CRC, precisely how many beds do we have?
I believe we haven't set up the upstairs totally. We probably have in the range of 20 to 30, capacity for 20 to 30 beds.
Okay, and your chart sort of showed a phasing out by, I think, next April of that facility. Is that correct? Or did I?
That's correct. Yep.
I hope that's the case, but do we have a plan B there if we're still stuck in the grips of the pandemic?
So if we have to continue the CRC, is that your question?
Yeah.
Yep. So we were stuck in that situation, as you know, about 2 months ago. And I think it took us, we had about 3 weeks to figure that out. I think we were very fortunate to find the location that we did. My understanding from our last meeting with Boulder Housing Partners about a week ago, they expect to break ground on, they're hoping to break ground on that development next, a year from this fall. So we could theoretically keep the CRC going probably another 6 months after that.
Okay, and my other question is the Be There program. That's not up and running yet, I take it.
That's correct. That's something we've been working on for about the last 2 or 3 months.
Is there any projected date for when it goes operational?
I believe it could be operational in the next 30 to 40 days.
Okay.
And with the grant money that with the county, it's new money that's come into the county, allow us to get that going relatively quickly.
Okay. All right. Thank you. Appreciate it.
Yeah.
We've got Mary, and then Adam, and then Rachel.
So thank you for that, Kurt and Vicki, and I see Wendy there too, so thank you all. I will start with kind of a follow-up to Mark's question about the Be There program. And I was just curious about what the difference, it seems like the EDGE and the Be There programs are kind of similar. So I just wanted to understand the difference.
Okay, so the EDGE program has been around for a while. I would say that it's actually quite different from Be There. The EDGE program, when someone calls 911 for the police and there's someone that needs mental health assistance, the EDGE program is on call and comes immediately with PD. Where appropriate, the mental health providers would provide the assistance needed to that individual instead of having it provided by a police officer who may not have the qualifications for that. And also, de-escalating situations as well. They often get called to someone who lives in housing. It's not a homeless program. So it's not an outreach program. It's more of a crisis intervention program. The Be There program is really identifying and trying to address what we see as sort of a shortfall in our work right now. And that's to better reach out and engage with individuals who simply are not engaging through our system right now. And more and a higher percentages of them are not going through the traditional coordinated entry approach. Still the majority are, but there's a real need there to get out in the community. And we've looked at other communities that have tried this, and it's helped with a number of things, not just engagement around that, but also as Vicki mentioned, supporting health initiatives and mental health in the field as well.
Thank you. And then you mentioned that there were about 7,200 people living below the federal poverty level, and that was when you were talking about making sure that we're focusing on the broad community needs, the people that are unhoused as well as people that have needs because they're living in poverty. So you mentioned 7,200 FPL. FPL is the federal poverty level is pretty darn low, $24,000 for a family of four. And so even at 200% of that, that's still pretty low and does require people to access services. So is there any idea of how many people are at higher percentages of the FPL?
I don't know that, but we could look that information up and get that back to you if we're able to locate that.
Thank you. But is it safe to say that there are?
It's well more than 7,200.
7,200 additional.
Absolutely, it's certainly more than that.
Okay.
If we look at, I'm trying to remember from our affordable housing program, but more than half of the individuals that we're serving through our affordable housing program are under 30% of the area median income.
Okay, thank you.
Hey, Mary, may I colloquy on that real quick?
Yes, please.
Great, thank you. Hey, Kurt.
Yep.
You mentioned that you actually took most of the student population out of that 7,200. I'm wondering, I know for a fact there are, unhoused students in Boulder. Do you have any numbers regarding that population?
We don't.
Okay. Okay, to continue, Adam? All right. With respect to the oversight committee that the HRC had requested, you mentioned that would not be possible to do at the city level. is that something that advocates could work with the county to examine?
I think certainly you would have received a letter, I think it was today or yesterday, from the county, where they mentioned, I think one of their paragraphs was specific about that and the need to really look at more engagement with the unhoused population. And that is a priority that was identified as well a few months ago with the HSBC.
Okay, thank you. And then how many affordable housing units are coming online between now and the sheltering season?
So good question. So there's 220 new units of affordable housing coming into our city in 2020. It's been probably one of the best years we've had in quite some time. The actual numbers I wouldn't know. The reason for that, it's not just new affordable units that come into the city. Boulder Housing Partners works now throughout their portfolio to look for opportunities for housing previously homeless individuals, not just new units. We also work with some of our other existing affordable housing providers. However, we've probably the best way to answer this is that if you remember that chart on how individuals are housed by month, we're housing for permanent supportive housing. We're housing, between 10 and 20 individuals every month, and we've been carrying on for several months, over a year, at that rate. So I think there's no reason for me to think that that's not going to continue, at least through this next season, and that we'll be able to maintain that. There's also been relative consistency with the navigation program, although COVID certainly impacted that, as well as the diversion program. So I think our numbers have been relatively consistent month over month. And in total, those numbers are between 30 and 40 individuals per month out of all those approaches.
And how does that correlate to the decreases in the number of shelter beds that will be available?
That's a great question. So it's not a one-to-one ratio. So if we're housing 15 individuals out of the shelter every month, or 10 every month, it doesn't automatically go down by 10 every month. We do have some individuals coming into the system as well, but I'm reluctant to give a ratio off the top of my head, but it's probably something like 2 to 1. So every two individuals or 3 individuals housed is going to reduce it by another individual at the shelter.
Okay, thank you. And then finally, with respect to safe parking and camping, what are there any land use issues, land use barriers to prevent that from happening?
So I'm going to pass it over to Charles. I'm just going to say one thing first before I pass it over. So safe parking and camping has been a discussion point for many years. It's been an idea that's been out there, as well as in our community. We looked at it at the Portland trip, there's different, also included in that are different management systems that would have to be in place. But the point of the Portland trip is the city council discussed this. We took a tour of sites in Boulder that were owned by the city and didn't find an appropriate site that moved forward. So I would move it over to Charles, and he could maybe talk about privately owned land and how that might work with that.
Great, thank you, Kurt. Good evening, Mayor, members of council. Charles Farrow, Planning and Development Services. So Yeah, the safe to park, it's kind of a fine line between, what would be considered an accessory use versus what really it would be considered a campground. I think if something's going to be routinely used, it would probably fall within the city's definition of campground, which are typically limited to the city's industrial zones and are reviewed through the use review process. So there are definitely land use considerations for how we would address something like a safe to park use.
But is there anything that would prevent a private landowner from establishing safe parking? So say a group of neighbors in a block wanted to allow people to safe park in their driveways, say, for example, on their property. Is there anything that would prevent that? Is there anything that would prevent a commercial property owner from establishing safe parking on their parking lot?
Yeah, I think we have some really specific regulations regarding the use of things like mobile homes in people's residential properties. The question is really enforcement as to, whether or not we would find out about it, whether or not it's one RV that's parking overnight or whether or not it's 8 RVs that are there for a week. But there are definitely land use considerations, again, that would preclude those sorts of uses on a regular basis.
If say a private property owner wanted to establish safe parking, somebody like I know Walmart allows parking in their parking lots. What do they have to go through what would somebody like that have to go through in order to permit it?
So again, where I think we get hung up is, where the Walmart in Boulder used to be, or if you use Target as an example, it's not an industrially zoned property. So you really wouldn't be able to use it as what's our definition of campground. So I think that's where you get land use considerations come into play just based on the underlying zone district.
So, what you're saying, what I hear you saying then is if there were a desire to establish safe parking or a campground, they kind of get lumped together, and because of the nature of them, it would have to be in one of the industrial zones, and I believe also the agricultural zone.
That's correct. Yeah, the A zone would permit campgrounds as well.
And it would have to be with a use review.
That's correct. In any of the industrial zones or the ag zone, a campground would require a use review.
And with respect to tiny homes, would it be anybody could establish a tiny home village if they found a parcel of land that was big enough and allowed the appropriate density?
Right. So tiny homes in Boulder are still required to be on a fixed foundation. At the beginning of this year, there was a building code amendment that was adopted that allowed home sizes to be reduced down to 400 square feet and, really address things like staircase geometry and egress, as well as loft ceiling heights. But they still have to be on fixed foundations. You still have to meet all of the minimum lot standards. So RL1 is roughly 65% of the city's zone land. You need a 7,000 square foot lot. You need domestic utilities. You need to provide your parking. So you still need to meet the minimum lot standards, utilities, and everything that would go along with really a single family detached home.
Okay. I think that's all I have. So thank you.
Do you mind if I follow up on that a little bit?
Sure.
Please.
Yeah, thanks for those questions, Mary. So Charles, in terms of, I understand what you're saying about campgrounds. Do you know what the rules are about, like, just say one single family home resident allowing somebody to sleep in a vehicle, whether it's a car or an RV or something like that? Is that something that people are allowed to do?
No, not under our current regulations. The code does make a provision for the allowance of somebody to sleep in a vehicle in a residential zone district 1 out of 7 days a week. So I think that's to address somebody who could potentially be a wary traveler and needs to pull over and spend the night. But you wouldn't be allowed to do it in public right away more than once in a 7-day period.
That's public right of way, but we just don't allow people on, say, a private residential lot to allow people to sleep in vehicles.
That's correct, yeah.
Okay. And then about the tiny home sort of village idea. So like in a low density residential zone, you could put one tiny home on a lot, right? Basically, unless you use it as an ADU, I guess you could do that as well. But there's this idea of villages, right? That some other cities have done. So if you found some lot that was maybe medium density or something, allowed multiple units per parcel, would you be able to do a tiny home village, or would you have to meet, like, say, side yard setback requirements for every single structure that would make it kind of essentially impossible?
I don't want to say it's impossible. It would be very difficult. And I liken it to the Ponderosa mobile home, where, we had conventional city zoning that we had to put on it and basically had to modify every single standard through the annexation. So I think if that was something that council wanted to do, they might think about crafting new tools in the code to accomplish it. I think it'd be pretty difficult under our conventional zoning, or absent some other legislative solution like an ordinance.
Gotcha. So we'd probably have to pass some kind of enabling legislation to make a tiny home village feasible.
Yeah, if that's something that council was interested in doing, I think that'd probably be the best way to go about it.
Got it. Thank you. And then Kurt,
follow up when you're done.
Yeah, I've got one more. Just,
when you're done.
All right, we got a chain here. Just one thing, Kurt, I just wanted to offer a slightly different memory on something that you said, which was when we reviewed parcels of land in the city for suitability. I think we were mostly thinking about tiny home villages at that time. My memory was that there were a couple that had potential to be used that way, but it was more of a policy decision by the majority of council to not explore that, rather than that it was deemed completely infeasible. And somebody can correct me if they feel like I'm wrong about that, but that was my memory of the decision at the time.
Thank you.
Thanks.
I've obviously completely lost control here. So before we go to the colloquy on the colloquy, I want to indulge Adam, because he's been waiting very, very patiently. Adam, is it okay if Mark and Rachel colloquy on Aaron's colloquy on Mary, or do you have something on this point as well? Because I know you've been waiting very patiently, Adam.
They can absolutely do that. I will wait my turn.
Okay, thank you for being generous. So I think Mark jumped in, and then Rachel, and then we'll come back to Adam.
Very quickly, thank you, Adam. Charles, I assume the impediments to doing a safe parking program are the same if you're a religious institution using your own parking lot?
No, that's a really good question, Mark. So the city has a history of partnering with a faith-based community in Boulder to support their mission by allowing the provision of an array of services. And that has at time included camping as an accessory use on a very limited basis. I can think of the Har Hashem, where they had some tent camping that occurred there, but it was on a very limited basis. And we had a management plan in place. It was very deliberate in how the situation was managed. And Tom, I don't know if you have anything to.
I want to add, there's a federal law, RLUIPA, the religious land use law, that basically limits cities' ability to through land use regulation to regulate religious activities. And there's some cases that involve camping and homelessness, provision of services to homelessness. So we tend to walk softly and try to work cooperatively with the faith community in this area.
And Charles, at some point at your convenience, could you put together a list of the various impediments to doing a safe parking program? So we understand what the magnitude of the ask is and can determine whether to deal with it or not, but at least we understand what has to happen.
Sure.
I appreciate it. Next customer.
Yeah,
well, could I colloquy on my own colloquies?
Well, I think Rachel wanted a colloquy on your colloquy,
okay.
and then if it's okay with Adam, we'll go back to you, Mary, and then we'll get to Adam.
Okay, so my colloquy question, I'm just curious, Charles, when you talk about campgrounds being okay in industrial zones, I'm not aware of any campgrounds in Boulder. Are there some that I don't know about? And also, like, when I think of camping personally, it's usually in someplace green, and I'm assuming we don't have anywhere green that one can camp. So I just wanted clarification on those points.
No, I'm not aware of any campgrounds that are active in Boulder right now that are privately.
Including in industrial zones, even though apparently one could maybe have a campground there?
That's correct.
Understood, right? Okay, thanks.
Great.
So there used to be, there used to be a campground, a KOA over at
Lake, right.
Valmont and like 63rd where Western Disposal is. But that's gone now. Just on the colloquy, and my colloquy was about going back to the faith community and their ability to provide safe parking / camping. They could work with the city and come up with a management plan, and away we go.
That's typically how we've addressed it in the past.
Okay, thank you.
Great. Now we have Adam, followed by Rachel, followed by Judy. Adam, thank you for your patience.
Thanks, Bob. I'm going to preface this by saying I have a few questions for various staff members, and then I'll let everybody else ask their questions, and I'll swing back around for questions to the board members that are here tonight. So my first question, I think, is actually for, it's sort of a broad staff question in general. I know we track the amount of money that we spend on, specifically on homeless services, social services, things along those lines, but does each department account for what dollars are spent in dealing with homelessness? And by that, I mean, does the police department account for the percentage of their budget that ends up going towards interactions with homelessness? Does the Parks and Recreation Service do the same? Do we have a breakdown of the ancillary costs of homelessness by department?
So I think I can answer that, but I think Jane might be able to answer it more completely than I can.
Okay, and I will. We have asked the departments to keep data on how much money they spend on homeless services. It is very difficult to do that because there are things that are easy to to understand, like the homeless outreach team. We can figure out what the salaries are and what the expenses are, but then there are other miscellaneous expenses that people spend on it. So the percentage of time that somebody from the Parks Department might spend in meetings and stuff. So we don't have it down to that kind of detail, but we do have sort of broad brush costs like the homeless outreach team, how much it costs to do cleanup that we do along the encampments. And then of course, the Human Services Department is our main focus in that area. So that is how we keep the information.
Okay, first, I think that information would be super useful for council to have, as well as what Kurt gave us. Second, I think it would be really interesting to see, what the total costs are and try to, I realize this is a really tough problem, but try to figure out what it costs per person, that we actually end up spending when we're interacting with unhoused people, so that we can know if we're, putting more money towards preventative measures, do we then truly save money in the end on everybody else who ends up having an interaction with unhoused people, whether that be cleanup or the police force, interactions, anything like that. I realize that's a very big ask, but if we're trying to be data driven, I feel like we should try to be as comprehensive as possible. That all sound like something, Jane?
Well, I agree with you that we should be as data driven as possible, and we certainly can get you the data that we have. But there are some data that I would not be able to give you. So an example would be this. Let's say a police officer is on duty for his 10-hour shift or her 10-hour shift and encounters a number of different circumstances, some of which deal with unhoused people and some of which deal with others. We do not break it down. We don't ask that officer to file timesheets on how much time was spent dealing with an unhoused person versus others. So I can't get that kind of granular data, but again, we can get sort of the broad brush data with regard to the homeless outreach team costs, the cleanup costs, things like that.
Thanks, Jane.
So
Chief
Adam,
Harold, did you have something to add?
Not really, Adam. Good evening, everybody. The only thing I can tell is proportion. I can tell you what proportion amount in the aggregate police officers spend on people experiencing homelessness.
Do you know that offhand, or is that something we can get?
It fluctuates, and I can tell you that we've seen a big increase, obviously, since COVID, but it fluctuates from year to year. 2020 being much higher than the other years. I can tell you that it bounces back and forth from approximately 10% all the way up to 20%. So a lot of fluctuation. It's seasonal, but it obviously that's I'm not going to call it a significant, but it's a proportion of what police officers do.
Gotcha. Thank you for that. My next question is about ticketing and enforcing the camping ban, and that's probably going to be best for Chief Harold and Judge Cook. And that is, when we give tickets by trying to enforce the camping ban, do people ultimately, what is the process end up looking like? They get the ticket, they either show up or don't show up to court. If they don't show up, then they end up getting in more trouble. And ultimately, do these people often end up going to jail who have multiple tickets for violating the camping ban, or ultimately are they back on the street anyway? So the camping ban isn't really able to be enforced since there isn't, something that's going to actually remove them from the streets. I'm just trying to clear that up because we hear from community members all the time, oh, we just need to enforce the camping ban and then things will get better. But is that actually the case?
Well, I think, is that question for me, Adam?
Yeah, either you or Judge Cook, yes.
Yeah, I think that I look at it as an intervention point, and I don't want to speak for the judge, but I think it all provides intervention points for services. And, just to keep in mind, the HOT team doesn't enforce the camping ban. So they are actively working with the most hard to reach clientele in our community to get services. So when we do issue citations, it is just one other intervention point to try to get people into services or some other type of intervention that will be positive for the community. I'm sure Judge Cook could probably speak after the citations are issued.
Yes, so first of all, there's a certain percentage of people who are issued camping tickets who don't come to court. And theoretically, at some point, a warrant could be issued for their arrest, and then we interact with them at the jail. But as the chief said, we really do try to use that as a point of intervention for people who come to court. Our homeless navigator can have a conversation with them that may be very brief or it may be pretty prolonged, but our goal is to refer them on to other homeless services in the community. And usually that interaction is the sanction itself. It's not we're doing that and a fine or some community service. Our goal is to get at the root cause, and that becomes the sentence.
Got it. Thank you both for that. I'm just trying to understand myself and help the community understand what exactly happens by enforcing the camping ban. And it's generally we're trying to divert them to other services, not actually arrest people and put them in jail.
Well, Adam, just keep in mind that in some of these encampments, we do find signs of criminal activity. I mean,
Sure.
We find stolen property, we find, drugs, we find people with felony warrants, we find people with weapons. So you know, the issues that the judge was talking about, we really tried to use that as intervention. I just don't want you to think that we're not, when we're investigating these encampments, we don't find signs of serious issues with criminal activity as well that we have to address.
Absolutely. Yeah, I appreciate you making that point.
Can I calibrate on that, Adam?
Yeah,
And I would like to colloquy after Rachel.
We're all on the same colloquy train here. So I guess I didn't quite understand the answer, like the most direct answer to Adam's question. So putting aside other criminal activity, let's say you have somebody who's camping and is not committing any other crime. If that person is arrested and is not interested in other services and so doesn't come to court or doesn't, you know, take up what's offered at these intervention points, and so then gets another ticket or another attempt at some point, is that something where a person would go to jail, or what would be the outcome if somebody just wants to camp and continues to get tickets?
So if somebody continues to camp, and they come to court, we're going to work with them repeatedly. And we're going to try to help engage them in the kinds of things that are going to help them move them along the spectrum from being homeless to not being homeless, working with them on getting an ID or birth certificate or some of those things. And that becomes the consequence. What that really does ultimately is creates engagement. And people who have not been engaged before start to engage. So that's like the best case scenario. If you have people who repeatedly get camping tickets and repeatedly do not come to court, then eventually, there is a warrant issued for their arrest. And when, at the time that they're arrested on that warrant, it is not inconceivable that they would receive a jail sentence, but a typical jail sentence for a camping violation is 1 day in jail. It's not, my discretion is up to 90 days in jail. We're not looking at something like that. To be honest, that doesn't really change a lot of behavior. Most of the people who are repeatedly violating have other things going on, like mental illness and traumatic brain injury, a whole range of things. And so really, again, our goal is to look at the root cause.
I appreciate the clarification, and I appreciate, Adam, you trying to just sort of clarify the scope of reality that we're operating in. Thanks.
Mary, I think you wanted to jump in and then back down.
Yeah, I just had a quick question about where I believe it was called warrant pulling or ticket pulling or something like that. And how does that fit into this scheme?
So what you're talking about is called warrant clustering. And that was a concept out of the city prosecutor's office. And the idea behind warrant clustering is that for low-level municipal court violations, such as camping, whereas we used to issue an arrest warrant the first time they did not come to court, we now wait until they've missed court at least 3 times on 3 different cases. And at that point, the warrant can be issued. What is helpful there from the police perspective, there's a lot of time involved when you encounter somebody with a warrant and they have to arrest them, and then they're off of the street and not doing their job while they take the person to the jail and they book them in and they go through that process and so forth. So if we could do that once for every 3 cases instead of 3 times for every 3 cases that are low-level cases, that's a tremendous help for the police department and the community at large. The other thing is once they're at the jail, they're typically there for a slightly longer period of time, which also then gives them the opportunity to engage with the services that are available at the jail. And the jail has expanded their treatment and mental health services pretty dramatically through some grants in the last year or so. And those are mostly done through community justice services at the, under Boulder County.
Thank you for that clarification.
Back to Adam.
Yep, one more question right now, and this is for Kurt. You mentioned there are some communities that we can't currently serve with the housing first approach, like people who are addicted to methamphetamine. I assume there's others, like as far as I know, people who have pets can't get into severe weather shelter right now. People who are in couples often can't. Are there, several groups like this that we can't provide temporary or permanent shelter to right now? just trying to clarify whether or not there are some holes in the system.
Sure. So I don't think any of the examples that you gave would certainly prevent someone from getting into housing.
Okay.
As far as pets, the Boulder shelter as well as 30th Street, their policy was service animals. I think it's been a number of years ago before we had our current strategy. The Boulder shelter did attempt to provide services for individuals with pets. It became from what I'm told, it became an unhealthy situation for other residents. So they unfortunately had to do away with that. For a number of years, it's been service animals. So individuals with pets, that would be correct. That would be a segment of the population that would be more difficult for us to not engage with services, but for shelter.
Gotcha. And couples, was that a correct one as well?
You know, Greg Harms is on the call. It'd be great if you got one question tonight.
Sure.
So maybe I'll pass that on to Greg.
Thanks, Kurt. Greg Harms here from the Boulder Shelter for the Homeless. We do not have the capacity to serve couples together. We do have couples that come to the shelter and they're welcome to stay, but in separate dorms.
Gotcha. Okay. I think that was it. But you did mention, I just want to make sure I heard this correctly, that people who have methamphetamine addiction, very hard to house right now as well.
Absolutely. I think it's difficult for every community. As Vicki mentioned earlier, we're engaging with an organization in Denver. I think we're very encouraged by their approach and some of their outcomes. And we're in sort of initial conversations about potentially having a program like that in one of our upcoming affordable housing developments.
And do we have any idea how many or what percentage of our homeless population does have methamphetamine abuse problems?
I don't believe that we have data on that. I'll look to Wendy to see if she has any data on that. No? Okay.
Okay. Well, if we can figure that out, we might know what percentage of our population is going to be very hard to house as well. So maybe if we can figure that out over time.
Well, I think our Be There program could probably assist with identifying some of those needs and data points.
Yeah, I'm definitely looking forward to that being implemented. That's it for now. Thank you.
Thank you, Adam.
One clarification on the service animals. Question for Greg. Is there are certain rules around what can be asked of a person with a service animal? Are there not, Greg?
Yes, that is correct.
And so that establishes, so you can't ask, it's my understanding that you can't ask somebody, is that really your service animal? And do you really have a disability that requires you to have a service animal? Or you can't ask certain things about that. So if a person says, this is my service animal, it is taken at face value. Is that correct?
The question we can ask legally is what service is the animal trained to do for you? That's about the only question that we can ask somebody about their service animal.
That's the only question that you can ask.
Correct.
Okay, thank you.
Great. I think we're on to Rachel, and then Junie after that.
All right, thank you, Bob, and thank you to all the presenters. I'm going to follow Adam's lead and ask questions right now, staff, and then I'll circle back to asking some members of the boards some questions after we finished. And while I have the floor, Bob, I just wanted to put in a plug for a break maybe after we've gone through some number of questions. Oh,
Why don't we, just so people can anticipate, why don't we get through the questions of staff, take a 5-minute break. Sounds like there's a few people have questions of the boards, and then I think staff wants to ask us questions. So let's get through Rachel, Junie. I don't see any hands up for questions. I have one question myself, which I'll tuck in at the end. So Sam and Mirabai, we haven't heard any questions from you. Maybe you don't have any. And then we'll take a quick break.
all right, thanks. So I had a couple questions on the slides, and I don't know that you'll need to go to them, but I'll just say which they are in case you're interested. The first is on slide 5, the homelessness continuum, and it goes at risk to newly homeless to chronically homeless. I'm just wondering, we hear a lot about people who've been in the community under 6 months or brand new. Where do they fit on this continuum? Like, which circle captures them?
Vicki, I'll let you answer that one.
So they're just like everybody else. They're going to fit in all spots on that continuum. I would say that what our experience, and Greg may be able to support this a little bit better, but the people that we see coming to CE or coordinated entry predominantly are newer to homeless, but maybe not brand new to homelessness.
So maybe somewhere between newly and chronic. It just seems like a lot of people that are sort of swept out of some of the more robust programs. So I was trying to figure out where they may fit on our continuum. Okay, my second question is on slide 6. Let's see, it says, and this is, you don't have to look at slide 6 to get this, but for the 6 months residency eligibility requirement, did that come from the city of Boulder or from the county?
That would have been from the county collaborative. So it would have been Longmont, Boulder County, and the city of Boulder together looking at that policy.
Did city council weigh in on that? Did we?
I don't believe so. No, those policies are relatively consistent throughout the county.
Okay. Let's see. I think on slide 14, I was just curious, I guess. It says it's talking about municipal court and homeless, the HOT outreach team working with challenging clients, and the number 1 listed is sex offenders. And I just wondered, what is the, like, given that that's listed first, are there, like, can you give us a number or percentage of people who are experiencing homelessness who are identified sex offenders?
So my assumption is that Judge Cook may be able to address that.
Yeah, I'm not sure that I can quantify that at this point in time. What we've started as a project is our homeless navigators is looking at everybody who's on the HMIS, which is the one home system for housing that is a Boulder County person. And as we have extra time, which isn't often, we are looking up their criminal histories. Those are not municipal code violations. So to find that, we have to go to the state court to discover if they have criminal histories or not. So we are working on quantifying that. That's not going to capture people who are not in the system at this point, of course. I do want to mention that sex offender is including a large range of violations. So the most common sex offense that is causing issues for people is a misdemeanor charge called indecent exposure that's filed in the county court. And so most of the sex offenders are not disqualified because they are felony sex offenders, but because of a violation like that.
Again, just curious, but could that include like urinating in public?
Urinating in public is not a sex offense.
Okay. All right. So next question is on slide 16. It's talking about the exits, 898 exits, October 2017 to April 2020. I'm just wondering if there's data, and maybe it was in here and I didn't see it, but on the long-term success. So people who exited in October 2017, are we collecting data on who is still successfully housed? Did I miss that somewhere?
So Vicki, you want to answer that one?
So we don't have that as data for our dashboarding, but I know that we do collect, particularly with PSH programs, they do When the case management from Boulder Shelter, for example, is working with the clients, they do keep track of, and the county as a whole does keep track of people who have returned to homelessness from PSH programs, because that does sometimes happen, or how long they have been in stably housed.
Does that mean we do have that data somewhere?
Not at my fingertips, no, but we, in theory, yes, it would be getting some information from the county.
I think that would be a helpful perspective for us to have. And I don't know how hard it is to get on like Reunited and Diversion, because I think people are often leaving Boulder, but I don't know if we're doing any follow-up tracking for people that are leaving, but I'd be curious, like it's good that people are exiting, and that's a sign of success, but also would be useful to know, is that success long-term?
Yeah, I will say that with navigation, there's a less strenuous follow-up process. When we put in the diversion program, we instituted a 30-day follow-up just to see if things worked out the way they were supposed to. Obviously, it's a fairly new program, so we don't have a lot of feedback on that yet. And as you can imagine, with a very low income population, cell phones change, numbers change. And so we're not going to get full 100% follow up on that.
Understood. And it might also be useful to have it at 30 days and then again at 12 months or something, understanding that it's difficult to gather. Okay, I think my next slide question was 25. And actually I guess I was just wondering, like, why did we give Safer Boulder their own slide that was equivalent to the HAB, HRC recommendations? And especially since there were other community groups that were writing in, like I was sort of confused to see that slide. So I wanted to just ask.
So that was a request by one of the council members to put that up there. We had different requests by different council members. And I believe, I'm trying to think back of other sort of defined recommendations like that. I don't recall them, but obviously we got a lot of input from a lot of different people.
We did, right. So I was just like, oh, that's a little bit, that makes sense to what you're saying. And I also wanted to just mention, while all the staff are on the line, that I appreciated, Kurt, you bringing up the Tipton report. And I know it's very hard to stand in this line of fire, and I appreciate everybody being here with us tonight. So thank you for doing that. And also just wanted to give props on the CRC. It sounds like that has had outstanding results. So thank you for that too.
Thank you.
Oh wait, you know what I do? That was all my slide questions. I have a couple more questions. I'm sorry. I like signed off, but I have a couple more. So one is, I was hoping to get a little bit more information on where can people go during the day, especially with library closed. And I know we don't have robust day services. So what's happening right now with daytime?
Vicki, do you want to answer that, or?
So you are correct that there are a number of people that would use our libraries that cannot use them right now, or rec centers. Other than those 3 locations, it's really not significantly different than it would be any other summer after severe weather shelter has ended, which is one of the reasons why you see the difference in services that are provided, day services that were provided at 30th Street versus in the winter months versus morning services at BSH now. But there are places such as Harvest of Hope where they can get their food. There are water facilities. But as for a hangout factor, unfortunately, there's just not a lot of options. And we do walk a little bit of a line with, when you are looking at a COVID and a congregate situation, in some ways, having them have some time outside is actually healthier because it doesn't spread as easily outside.
Vicki, if I could just add a bit to that as well. So having the city facilities closed has been a challenge for us. So some of the things that we've implemented related to your question If you remember, we opened up 30th Street for day shelter, or I'm sorry, for day services. And then as soon as they closed, we opened up services each day at the North Boulder shelter. We also struggled with bathrooms sort of in the 30th Street area. We were in conversations with Hope about putting a portable toilet there. They do, however, because they had a public bathroom prior to COVID, but that also closed. So they have been giving out water. But then we also opened up at the Mapleton Fields, we opened up because it wasn't possible with Hope, we opened up a temporary facility at the Mapleton Ball Fields. Obviously, we have new toilets and bathrooms at the along the creek at 9th Street, where a lot of the individuals have been, but that has been a challenge.
Okay, appreciate that. I think maybe two more questions. One is, we got an email from a community member talking about rapid rehousing vouchers and sort of prioritization for placement, and with COVID, maybe people over 65 jumping in front. And I just was hoping you could give us some more clarification on, especially with, we anticipate additional evictions. What, do we have concerns about who's in line and how that's all going to play out, and the increased capacity needs? I would imagine possibly without increased capacity beds or shelter or housing options.
Yeah, so that's a great question, Rachel. Yes, we do have that same concern. On August 4th, we'll be giving council sort of an update on the steps that are in place and will be added to prevent and address evictions. And we'll be covering increased funding that we've allocated, increased mediation services, particularly integrated with the court system, working with Barha and Boulder Housing Partners, as well as our other providers. So we'll give a more comprehensive presentation on all those various steps on August 4th. We really want to make sure that we have the necessary resources and support to prevent evictions, and not just evictions, but people losing their housing, which is probably a bigger number than evictions. We really want to prevent that and from people going into homelessness.
Okay, I will look forward to that in August. And then last question, I think you agreed with this portion of a couple recommendations, which is engaging people with lived experience more. So I was just wondering if Vicki or Kurt or Wendy or any of you who do this frontline have suggestions for how we could engage people with lived experience in a more robust and continuous way. Because I noticed we as city council members don't hear a lot from people who are actually impacted by the decisions we're making. We hear a lot from neighbors and people who work at the shelter and things like that. But I don't feel like there's much of a voice for the individuals who are impacted by our decisions. So I just invite suggestions or creative thoughts there.
So I'm gonna ask if Wendy could answer that, so she could also get one question tonight.
Oh, Wendy.
And we also look forward to your recommendations from council.
Good evening, council members. Wendy Schwartz, Human Services Policy Manager. So Rachel, I don't have the exact answer to your question in terms of here's how we do it. But what I will say is that we, in the broader partnership, Homeless Solutions for Boulder County, what we've recognized is that the mechanisms that we have sort of tried at the beginning are not effective in really having meaningful input from people with lived experience. And so that's that's an issue that needs to be corrected. And I know Robin Bohannon referenced to that in her letter to council. And so what HSBC is doing now is starting a process of trying to reorganize some of its advisory boards so that there can be a structure that feels comfortable and meaningful for people with lived experience. And we think that that is going to be something that will be probably more fulfilling and satisfying for people than having an advisory board to just the city, because as Kurt referenced earlier, there's a lot of HSBC and the decisions, the joint decisions that are made, such as, for instance, the 6-month question you asked earlier, that are not just under the city's control. And so I think that's just a better mechanism for giving people meaningful input about all the decisions and not just ones that are solely controlled by the city.
Thanks.
Okay, Rachel.
Those are all my questions. Thanks everybody for your patience.
Okay, Judy, I think you're the last one with your hand up.
Thanks, Bob. Can you hear me well? I hear an echo. Can you hear it as well?
A little background error.
Okay. Yeah, thank you very much. I have a few questions, and I just wanted to say I've had the opportunity to go to the CRC, and Kurt gave me the tour, and I was very impressed with the work that's been done there and the level of service and the level of care and attention. And that's very important because, as we know, people who are homeless or people who are unhoused, somehow they often fall in the margin. And to know that we care about them says a lot about our community. But I want to get to the substantive issues. And I wanted to ask you, I saw a proposal from Graham Hill, a community member, several months ago, and I think he submitted that same proposal maybe a week or two ago, and it was about supportive outdoor living, and I wanted to know whether your office had taken a look at that proposal and its feasibility. That's my first question.
I don't recall that one specifically. Wendy maybe recalls that one, or Vicky.
I believe that was the document that was forwarded
Judy, maybe you can mute while they're answering the question so we can. I think it's your microphone.
Okay. Sorry.
Yeah, great. Go ahead, Wendy.
So yeah, that proposal we did take a look at, and I would say that I guess the concerns that we had with that proposal are really the same concerns that we have about setting up encampments in general that were just discussed through the presentation. We did also, as Kurt mentioned earlier, review Mr. O'Connor's budget. And so there, would appear to be a somewhat optimistic budget because there's a lot that's not included that either he's not planning on offering. So for example, food, or perhaps he is planning on getting it all donated or some other measure. So, so for instance, that expense alone is probably a little over $250,000 a year. And that's not included. So anyway, I don't know if there's more that I can say about that can be helpful, Ginny, but we did take a look at it, and I would say that it kind of goes into the same line of discussion we had earlier about encampments in general.
Thank you. I think my next question is about, you talked about the no suitable site on public land, and I wanted to go back to a comment made by Mark, and he wanted more research. And I was wondering what is maybe looking at possibly providing us some information on whether it's possible to repurpose or parking lots. And the reason why I think about that is because you mentioned, okay, the only two places that you could put a campground is either on industrial or agricultural land. And I wanted to know whether, since we already have parking lots in Boulder, we have lots of them. And I remember even when I was running, you know, we talked about how can we repurpose some of our parking spaces and have less parking? Well, that's a different discussion, but my question to you is, and I know that we also have the 343 at night to help community members to park or people who are traveling from other places to work in Boulder. So I'm wondering what's the feasibility of repurposing some of our parking spaces from let's say from 7 p.m. at night or 11 p.m. at night to 5 or 6 o'clock in the morning so that people can still get the opportunity to park, let's say an RV or just sleep in their car if we cannot have a safe parking program in Boulder.
Charles, before you go, if I could just input, Joni, maybe you could put yourself on mute again. Thank you. Let me just make one statement before Charles jumps in. Rachel asked a very similar question recently. So both at 30th Street when it was open, as well as the North Boulder shelter, individuals who have cars can park their vehicle there, and they can have services at that location. They can, instead of sleeping in their car, they can sleep at that location. So we currently do have, and we have had for some time, services that integrate with individuals who have to park somewhere. So Charles, I'll leave the next area to you.
Great, thanks for the question, Junie. So I think we could use parking lots overnight in properties that are zoned industrial through the use review process to allow overnight camping or parking, because I think it kind of falls under the same definition of camping. So I think that's a possibility under our existing regulations in industrial zones. If you wanted to do it in different zones, like say the Target parking lot from the hours of 10 p.m. to 6 a.m., there would need to be changes to the city's code in order to accommodate that.
Okay, so what you're saying is that even parking lots that are owned by the city, it's not possible to have the repurpose option.
Right, not without a zoning change or unless the parking lots were in an industrial zone.
Okay, thank you. My next question has to do with budget, because I know earlier you mentioned how much it would cost to have, or how money would be divested from providing housing to having a campground. And I wanted to know what, even if it's not tonight, maybe add that to the list of information that you will provide council eventually. What would be the impact on HHS budget if we were to have a public-private partnership for the provision of these services? Because to me, I think there's two parts to it, because I understand it may be something, it would be very costly for the city itself to undertake the project of finding the land, buying the land, and also doing all the servicing. But if we have other organizations doing it and we can partner with them, either, I don't know what that would look like, but what would be the impact on our budget, on the HHS budget?
Yeah, so we would have to put a sort of a project plan together and do a budget for that. We wouldn't be able to pull numbers out of the air to understand what that would look like though and the impact on our budget. As far as sort of safe parking, communities that do safe parking, they do have costs associated with those as you've sort of outlined, but there's also things like security and management and, bathroom facilities and that sort of thing as well.
May I follow up? But there's nothing to prevent the private piece of the public-private idea to just have a private party or community-driven party to come forward and say, we want to create the safe parking. We found an industrial zone and we want to create the safe parking and camping and or campground there. Or to have a private party or community organization partner with a faith organization. There's nothing to stop anybody going forward with that, going through the fundraising process and raising the funds and then moving forward with it.
That's correct.
Thank you.
Well, I guess I will colloquy on my own statement is because we're talking about industrial land and agricultural land, and I wonder if in Boulder we have that space. Do we have those land available for such purposes?
Charles, I don't know if you can, what input you can give to that, probably better than me.
There's plenty of parking lots in the industrial zone. I think that could probably be used. Not much raw developable land, I would think.
Thank you. And I think my next question has to do with, Mary mentioned earlier as you were talking, the 7,200 people living below the poverty line adjusted for college students. And I thought that was shockingly low because I was looking at our numbers back in 2019 and they were about 21 to 23% when it comes to the poverty line. So I was wondering, where did this number came from? How did you come about a statistic that is that low? And you might, and my next questions for you on that same issue is, do you have university or college students who come to your department for services, and what is the referral process?
And do you want to address that?
Yeah. So thanks for your question, Judy. One thing that often happens, sometimes if you look at people just pulling the census data for the city of Boulder, and they pull a percentage for people under the federal poverty line, you'll see a higher number or a much higher percentage. And you'll notice that we look very different to the communities around us that don't have a major university in them. And so you may have seen numbers in the past that were pulled in terms of just the raw income data. And sometimes that causes challenges for college towns like ours because, certainly we can't say that there aren't college students that are in very impoverished circumstances and might need help from the city or our contractors. I'm sure that's, certainly true for some people. But the reason that some of our staff worked with the state demographer's office to try and adjust that number to kind of mitigate some of the impact of the student population on those numbers and percentages is that it can be, if we don't do that, it can be unintentionally misleading because there are also a fair number of college students who they show no income or very minimal income, which puts them below the federal poverty line, but they might be being supported by their parents. So for instance, they're not likely to necessarily need the types of housing and human services that we and our partners provide. because even though they're showing a low income, they have family support. So does that make sense as an explanation for how that was adjusted and why?
Yes. Yeah, thank you. And I mentioned to you, do you have a referral process for college students? Or do you work with the universities or the colleges around Boulder?
Vicky or Wendy, you want to answer that one?
I'll go ahead and start. So first of all, CU does have some of its own services for students in need, and it's too bad we don't still have the CU people on the line, because we could ask them, but we can follow up on that. And then in terms of breaking down the broader population served by us and by our funded community agencies, I think we'd have to ask that question because we haven't really broken it down that way in the past.
Thank you. I think my last question has to do with when you talked about the campaign ban and you mentioned that right now we're not enforcing it, and you mentioned ticket as a form of accountability, which I'm not so sure about as whether it's a good way of looking at ticketing poor people. And I think it's somehow recreate a vicious cycle where you're already poor, you get a ticket, and then it creates more problems and you just never get out of it. But I think that goes into my question as well, which is, when someone get a ticket, is it a monetary? Is it just a warning? What is it a ticket to the homeless population look like?
Chief Harold or Judge Cook, would you like to answer that?
I can answer the part when it gets to court. I'm not involved, obviously, in the part where the decision to issue a ticket is made and what the thinking is there, but they are written as a ticket where they can pay a fine and close their case. But we understand that that's not going to happen because these people are severely impoverished. And so again, the strategies that we use is trying to figure out what are the root causes that cause them to get the camping citation in the first place, and how can we help them? And that's really the role of our municipal court navigators, is to interview individuals, find out where they're at. They frequently are referring them to coordinated entry or other services in the community. But that's our sort of consequence, if you will. There is not a fine imposed. It would be rare for jail to be imposed. We don't even use community service much anymore. We're trying to help them do something that will be productive to them, such as getting a driver's license or an ID or something like that.
Okay, thank you. I wonder if Chief Maris have a comment on on the ticketing issue.
Yeah, I would say that on the encampment situations in Boulder, that the police go out and issue warnings, and we combine that with the HOT team to try to get services involved before tickets are issued, and tickets are given in situations where we feel like there's a public health issue. There's other activity going on that further complicates it. Repeat complaints from citizens that their encampments are blocking access to certain parts of the community trail system. So there is a whole host of warnings and services offered almost at every intervention point before tickets are issued. And so we work in close partnership with all of the services in town. And so I would say that issuing tickets, even though sometimes is needed, it is not the first intervention point the police department goes to. If that's helpful, Junie.
Thank you. That's all my questions for tonight. Thank you.
Thanks, Judy. Sam has his hand up for questions.
I just have one question. So this may be to Kurt or Vicki. It looks like the governor signed House Bill 1410, which is the COVID-19 Housing Assistance Program, which gives about $20 million for rental and mortgage assistance. Is city staff planning on working to get some of those funds, or would that be more of a county responsibility where most of the human services funding resides?
I'll let Vicki start with that. We may want to finish that question on August 4th.
That was my short answer, is that I think that is part of the August 4th. I will say that we have been in conversations as a collaborative to look at how we are using specific funding sources throughout the county and where it makes sense to fund them. And that goes for not only this money, but other CARES Act funding that has come through us.
Okay, very good. That's my only question. Thank you.
Thanks, Sam. We have no more questions. I'm going to defer. I'm going to skip my question. That was a robust discussion. There's been a request for a break. We'll take one. I just want to do a real quick time check. We had allocated 2.5 hours for this. We're now going on 3 hours, and the things that we have left to do, I know some council members wanted to ask questions of the board members who are with us, and then we each need to go around and answer the questions that staff has asked us, which I imagine will take a bit of time. And then we still have a presentation by the city attorney's office, although we've covered some of that material already. So I just, we can go as long as council wants to. I just want to be cognizant of the time, and if it's the will of council to have a lengthy meeting, that's fine. So let's take a 3-minute break. I've got 9:54. Let's come back at 9:57 and resume with questions for the board members. Okay, it's 9:57. Let's get back at it. Adam, you have your hand up. I know you mentioned you have questions for the board members that have joined us.
Thanks, Bob. Yep, this can be for either board member or both. So I know there was some discussion of discrepancies in staff's data versus what the boards found for some of the information about campsites and parking and just other cities' attempts to, help the unhoused population. I just wanted to see real quick if they could provide a brief discussion of what those were, what they see as, those discrepancies are.
So am I on now?
Yep.
Yes? Okay, so Lindsay, I'll go first if it's okay, and you can follow up. We got the memo.
Judy, I'm sorry, Judy, could you identify yourself for the audience?
Oh, I'm sorry. Judy Nog, I'm representing the Housing Advisory Board, and thank you for having me. So a joint meeting of HRC and HAB, Human Relations Commission and Housing Advisory Board, was called for June 29th without a whole lot of advance notice, and we got the memo from staff, I think about 4 or 5 days before. And so I just sat down and read the memo without any preconceptions. And I was alarmed when I got to the data that had been supplied in the memo, both to our group and also to council, but that wasn't in the presentation tonight at all. And there was a lot of data for people who are watching, comparing information from other cities across the country, maybe 7 or 8 cities. And it just so happens by coincidence that I'm very good friends with somebody who runs programs working with homeless populations or the unhoused in Seattle and in King County. And I just sent her the memo because I get her organization's newsletter, and they've been talking about how great their additional programs are. And she was freaked out, and she got other providers and experts in the field to look at just the Seattle and King County data, and found a lot of misinformation from their point of view based on their own outcomes. And these aren't anecdotal stories. These are hard data from their program outcomes. And so when we had our meeting, I asked staff where they got the information, and they said, my understanding was that they said they got it from secondary sources and they got it a little while ago. So I don't hold them at fault for that, but I am very disconcerted because it was the information that was provided to us as the underlying reason for the conclusions. And if they were discordant with the information from the service providers themselves, that alarmed me, because we're making big decisions on data that, at least in those 2 cases, is somewhat questioned. So that's how that problem started. And I was surprised that none of that was included in this presentation. But I also want to add, I don't find fault with anyone. I think the presentation today was great, and there's a lot of great things everybody's doing. I just, my background is nonprofit management, and I'm really concerned about the data on which decisions are made being accurate. Is Lindsay?
Thanks, Judy. Adam, I was just sitting down as you were asking your question. Can you repeat it, please?
Sure. I was just asking, I had heard that there were some worries about the discrepancy in the data like Judy was referencing. Did you have anything to add to her? I think she gave a pretty good answer if you have anything.
Lindsay, maybe identify yourself, Lindsay, also.
Sure. Thank you, Bob. Yeah, and thanks everyone. Thank you for having us. I'm Lindsay Loberg, and I'm representing the Human Relations Commission. I think Judy answered that question. I think from the Human Relations Commission perspective, what we're providing, I think, is a number of years of public feedback that are informing our concerns that were contained in the letter, which is less around the data, but I think speak to some of the discrepancies you might be mentioning.
Thank you both for that. That's helpful. I'm gonna pass on to the next person who has a question.
Great, and that next person is Rachel.
I've been busted eating. I thought maybe Adam had a couple questions. All right, so pardon the chewing. So I guess it's pretty late, and I thank you all for staying on this call so late. So I'll try and just ask a succinct question that can hopefully have a 1 to 2 sentence succinct answer. Ultimately, what do you hope is the outcome of this study session? What would HAB and HRC like to see City Council maybe green light? Again, not all 11 points, but like in a sentence or so, like what are we hoping for from your perspectives?
Lindsay, do you want to go first?
Sure. Thanks, Judy. Yeah, we would, I think like Judy mentioned, we didn't have a lot of time to really dig into a set of recommendations. And what we would like from you is a green light for a subcommittee that's already been formed to explore more deeply the recommendations that we were able to make in those 4 or 5 days and within our first meeting. So part of that would be the willingness to hear more specifically about the recommendations contained in the letter that you received from us. Judy, do you have anything to add?
Yeah, and Rachel, I'm really afraid it's going to take probably about 5 sentences. I apologize, but I think it's really worthwhile. The thing that both boards really want the very most is for the conversation to continue. We think that there's a whole lot of voices out there, advocates that we hear, people who have been unhoused before or now, the people that Safe Boulder or whatever, they have a really legitimate complaint about feeling that the creek and other places aren't safe. And we look at that as the another side of the same coin, that although there's so much good that's been done, there's still more to do. And we also would like some public hearings, and we would volunteer to do them for you so that staff doesn't have to put in the time and so that council doesn't, and we can report to you. I personally would be happy if staff contacted the providers in Seattle and King County to just check in with them. They've all offered. We are concerned about the severe weather shelter, and we really would like to continue. The committee of 2 people from each, the board and the commission, would really like to work, perhaps get input from staff, and perhaps have a council member or 2 that we can talk to and make some progress on some of these issues. Even, and there were some that staff was not opposed to.
Thank you. I'll go to the next person with a question.
There's not a next person with a hand up. Anybody else have any questions for Lindsay or Judy? Okay, well, Lindsay and Judy, don't go anywhere. We could come back in questions later on. So thanks for being here tonight. I think we're now at the point of the meeting, unless we have other questions for staff, where staff gets to ask us questions. Kurt, could you put, or Sarah, could you put up the question list, please? The 4 questions. Could someone say yes, and we're working on that?
I'm working on it.
Okay, thank you. I think the first question, let me make a suggestion while Sarah's doing that. It occurs to me the first question is kind of the big question of the night around interventions and whether council wants further work on these various types of interventions like safe parking and or camping or tiny houses. We've heard the recommendation of the 2 representatives of the board. That's kind of one question. And then the other 3 questions I think are kind of in one bucket, I would suggest, which is basically, are you other than whatever we're going to say on that, are you guys otherwise cool? So I'm going to suggest that just for purposes of time, we kind of aggregate questions number 2, 3, and 4, which is Do we have any more input? Do we think the balance is right? Do we think the strategy is aligned with good programs? I think those are all kind of the same questions. So let me suggest we go through one by one, answer the first question as succinctly as we can on whether you would like more work done on these interventions, or whether you would not like more work done on these interventions. I don't think we're going to make any decision tonight that we're going to set up a campground or a safe parking zone, because I don't think we have enough information on that. So I guess the question is, do you want staff to do more work on that and come back? That's the way I'm going to interpret the question, Kurt, if that's okay with you.
That's good. Yep, that's good. That would help with time.
So let's just kind of go through one at a time and answer kind of that question, whether we want more work done on this, or whether we're happy with the staff recommendation that we not do more work on it. And I have lined up so far Mary, Mark, and Adam, and Rachel in that order.
Thank you. So on question number one, the interventions, it seems to me that there is the potential for creating a safe parking / campground with a privately funded and community driven kind of approach. And there's nothing to prevent a group of advocates from getting together and doing some organizing and working with perhaps a faith community whose parking lot they could use, or to find an industrial zoned parking lot that they could use, and then work with the city to come up with a management plan and go through a use review, because a campground would require a use review. So the advantages to that would be that it wouldn't be a long drawn out process, because such an effort would not require that they do community outreach, which is something that the city has to do. We have to follow our community outreach, our engagement process. They wouldn't have to do any RFPs for the providers. Graham Hill appeared to have somebody lined up that could do something like that. So that group could reach out to Graham and work with him. And I also, and could also as well reach out to the King County providers, which are, from my understanding, they're a nonprofit. So it could all kind of happen outside of the city's efforts, because to answer the rest of the questions, I think that there is one thing that I would like to have a little bit more input on, is that there does appear to be a shortage of beds for upcoming winter. And I guess I would like to better understand that and see if there are a few more beds that could be had. The balancing the resources, I think we're doing a lot with what we have. And I would rather spend the money on actually housing people than creating pilot programs that really don't move people out of homelessness. But I do think that there is potential there. And if there were a community group that organized it, they could keep data and come back and present that to council as to what their outcomes have been. And then alignment of the homelessness strategy. I think it does align, and I think that in lieu of a national strategy, that these best practices that people around the country have adopted are what we have to work with. And I think that we are doing the best that we can with the resources that we have available. And I would also encourage community groups as well to, if they were interested, to help with more fundraising so that perhaps we could put more money into it. So that's all I have.
Thanks, Mary. We've got Mark and then Adam. Mark, you're on mute.
Thank you. I would have gone on for 5 minutes. I found the staff presentation to be extremely detailed and evidence-based. Having said that, if HRC and HAB want to take a deeper dive into issues like alternative interventions, I would encourage them to do so. I regard the conclusions in the staff report as essentially rebuttable presumptions. And if HRC and HAB wants to take a crack at articulating a different path or what they believe to be a better path, I'm fine with them doing so. Otherwise, I'm content with our homeless programs to the extent of our resources. In a better world, we'd have much more in the way of resources. We could come up with better solutions, but I believe that the housing first philosophy should remain our guiding philosophy. And with the caveat that we can explore some other solutions, as Mary suggested, that are largely private sector driven or involving charitable organizations. And if we can come up with some good solutions in that arena, we can implement them. But otherwise, I'm taking my guidance at the moment from the staff report, and I'd like to see HAB and HRC explore some of these other options if they are prepared to do so. Thanks.
Thanks, Mark. Mary went into the second batch of questions too, Mark. So let's just to be consistent. Do you have any comments on the last three questions, or was that subsumed in your answer?
It was subsumed in my answer. I basically think we're doing a good job within our capabilities. I wish we had more resources to do more, but I'm not prepared at this point to suggest that we are on the wrong path.
Great, thanks, Mark. Adam, then Rachel.
Thanks, Bob. Yeah, I see overall the strategy as a really, really solid foundation. Everything we've done to this point is commendable. And in my opinion, I think we need to fill a lot of those holes that were talked about throughout this presentation. And I think greenlighting HRC and HAB's recommendation to explore it further is a pretty important step for tonight. I would definitely support that. Having been a member of HAB and knowing the diversity of opinions and people and experiences on that board, to have it be unanimous and then unanimous alongside another board tells me that this is a real issue that they really want to tackle and sink their teeth into and think they can provide additional input and ideas around. So I don't want to preclude them from doing that in any way. I won't speak to anything individually. I think there are a lot of good ideas here to explore, but as the first step, I think we should just allow them the bandwidth and give them a little bit of staff resource time to look into these areas a little further and see what we can get out of it as the best first step. It seemed to me like the staff, their biggest issues were surrounding what are the details of any given one of these plans. And unless we give them the time, I don't think they can, either the boards can either give good background as to what the specifics for tiny homes or the specifics for day sheltering or encampments would be. But I think I would be supportive of listening to their findings and their further suggestions.
Thanks, Adam. And Adam, do you have any other comments, as long as we'll just do all these questions at once?
Sure. As I said, I think we have a really good foundation, but things like people who are addicted to methamphetamine, that one really sticks with me because I know that's a large population and I know that's a problem. So if we can't house those people, then a housing first solution isn't the only thing we can be exploring right now. And that shows to me there's a glaring hole for maybe not housing first being the ultimate solution to every problem, at least in the way that the systems are currently set up. So if that means more funding for different resources, that's great, but we need something, a way to provide safety to people, even if they have mental health and addiction problems in the short term, especially if we can't house them because no one wants to take them in based on their problems. So that's all I'll say, Bob. Thank you.
Thanks, Adam. We got Rachel and then Aaron.
Okay, well, I agree with most of what Adam just said. I think if we're gonna greenlight HAB and HRC, which were, as Adam pointed out, unanimous with the over 2 board recommendation, we're gonna greenlight them to go forward and dig deeper. I don't know how much more I really need to say, because I think they're going to look at the issues, like, do we have input to changes on homelessness programs? I assume that's what they're going to be, that's what we're greenlighting, is for them to dig into bullet points 2 through 4. So I guess I'd want to reserve weighing in on those bullet points if we're not going to greenlight them. If that's not the will of this council, I'd want to come back and revisit those. But if we are going to do that, I trust that they will have a robust process and look, and I trust in that process. And the only other thing I would add is I find it confusing, sort of the intersection between city and county. I understand that we are partners, and it's sounds like a good, healthy working relationship, but it's, I guess the impacts of homelessness are felt in our city, and we get communications and issues from the things that people who are unhoused are dealing with. And so it's like, when we say let's have individuals with lived experience go to the county level, I also think we need something that's vested here, where we are giving people with lived experience and a forum for us to participate in and hear from them. And that somehow there feels like a real big disconnect between this city council and what happens at the county, and like the fact that we don't weigh in on what the residency requirement is when that deeply impacts our own community members. And I understand we have staff members who are weighing in, but as a council, that disconnect feels big to me. And I especially as it impacts people whose voice I really want to hear, I would like us to give them a forum somehow in that space. Thanks.
Thanks, Rachel. Aaron, then Sam, then Mirabai.
Yeah, thanks. I'll agree with much of what's been said, particularly the comments that Rachel and Adam made. I do support having HRC and HAB do additional exploration of these areas. And one thing I'll say, Rachel, you said points 2 through 4, but I'm interested in them looking at 1 through 4, which I think you meant as well. Don't let me put words in your mouth, but just want to clarify that. I think, staff, as I said before, has done a phenomenal job with this presentation and with the system of services for folks experiencing homelessness. But there are still people that are not served by that system, people who fall through the cracks for one reason or another. Say folks who are not, there's not yet a housing slot open for them, and that are shelter averse, whether it's for reasons of PTSD or a pet or some other condition. And so offering some kinds of different options for folks in different situations, I think, is worth exploring. I think we also have to be aware that we're going to do everything that we can to prevent a wave of evictions in our community, but the economic crisis from COVID is not going away anytime soon, and we may well be facing some significant additional problems with people not having secure housing in our community. And so I think we need to make sure that we have a broad toolkit to cope with that. So I would like to hear more from HRC and HAB. I really appreciate the work that they did on putting those preliminary recommendations together. I would like to see them explore those more. And sorry, I lost my train of thought for a second. But, and you know, not every single one is doable. Like staff mentioned, for example, that you know, we can't single source path to home back to Bridge House, but that doesn't mean that we couldn't use some kind of successor program to path to home. So you know, let's not dismiss anything entirely out of hand. The one other thing I want to speak to is the issue of the well, actually, before I do that, just Mary, I thought your points about private organizations could put together something like a safe parking program. I thought that was a great point. And you know, maybe we can get the word out there that if there are faith communities or nonprofits that are interested in setting up some kinds of services, that's something that is possible and something that the city could just do a little work on facilitating without having to take the lead on that. So if anybody out there is interested in doing something like that, that's maybe something we could help some with, but not have to run a city program. So that was a great point. So anyway, my last thing is I am very concerned about the potential capacity issues with severe weather shelter this winter. And so, you know, what I hear from staff is that at the moment, they're doing a lot of work to house lots of people, which is fantastic. There are huge successes there. We have more capacity available because of that, but that we don't have a backup plan at this point if capacity is lacking. And so I would really urge that we develop some backup plans, you know, some kind of overflow options, or, you know, maybe it's another crack at a severe weather shelter location, but at the very least, some kind of overflow plan, you know, maybe done in partnership with faith communities. But I very much want to see that. And I'd appreciate it maybe if other council members could weigh in if they feel like that is an important priority for us to be pursuing going into the winter sheltering season. I'll just leave it there.
Thanks, Aaron. We've got Sam, Mirabai. Rachel, you've got your hand up again, which is fine, but I wonder if we should let Junie in there because she hasn't spoken before you have your second go, and then I'll go at the very end if there's no more comments. So maybe we could do Sam, Mirabai, Junie, Rachel, and Bob.
Okay, thank you, Bob. Let's see if I muted. Yep, I'm unmuted. Cool. So as we look at the first question that staff put up there, I want to start before I go into potential other things that we could do by saying what a great job I think that our staff has done in collaboration with the county. You know, I think some of us have perspective on what the system was like before the change in the system to coordinate with homeless services in Boulder County. And it's night and day where we are now. The data that we have is just so much more robust. The knowledge that we have about who's using our system, what their outcomes are. I mean, in the past, if we go back even 5 years, we wouldn't have known anything about most of who we're serving. We certainly wouldn't have exits data because that wasn't exactly the focus. We had just started housing first at all with the Lee Hill location. So I just want to compliment staff. You take a lot of heat. A lot of people impute not only bad motivations, but bad performance, which I think is completely undeserved. And I just want to say that you're doing work that's excellent, both in its execution and in its vision. There's always more to be done, but we need to take a pause here as long as we're going to do what we're doing tonight, which is essentially a review of where we are and recognize the progress that we've made and the outcomes. So that the number of exits is phenomenal. And as everyone who studies this says, you know, the ultimate solution to homelessness is housing. Maybe there's another rung or two on the ladder that we need to put in, but that focus on the ultimate solution for homelessness is one that we should celebrate how far we've gotten. And then the other thing I'd like to put out there before I dive into the question is the way that social services are administered in Colorado is through counties, right? And so what the city is doing with our $4 million budget for human services is above and beyond what the structure that is supposed to support this looks like. If we look at the amount that we contribute to the Boulder Shelter for the Homeless, it's a relative pittance compared to what the county contributes. And that's because the county gets a fair bit of federal funding that they can then pass on to the organizations, the community partners that we have. So I think that we do need to understand that we are operating in a system where what we do is in addition to the systems that are in place. So we also need to recognize that not only the money that goes directly through human services, but things like the work that Judge Cook does for us in the courts, the work that our police department does, is also above and beyond kind of the normal practices. And that it's the entire system that provides the support. So I think what HRC and HAB were pointing out is holes, and those holes might be able to be filled or they might not. I think it's worth looking into which of the potential alternative programs would be the best. So I don't mind at all looking into whether camping, and I've worked in the past on trying to create a campground. It's much harder than people would think. It requires finding a partner who will run it, and that's not a trivial thing to do. So I look down the HAB HRC recommendations, things like pilot 2 to 4 encampments within the year. I think that would be very difficult to do. So I think the idea, and you go down the list, and and any one of the things on the list alone would be a full work program for staff. So I think as we direct HAB and staff and HRC to look into this, we need to understand that that's going to be a pretty heavy load for them to take on, particularly in light of COVID, particularly in light of what Aaron mentioned, which is the coming potential eviction crisis and increase in homelessness. We need to be careful not to add to the plate to the detriment of programs that we currently have, that we currently care about and may care about more, such as severe weather sheltering. So I'm going to come back to what Mary said and point out that if there is energy and funding available to do something along the lines of, say, parking, that's one that has a place where it can fit within zoning and with the use review, and could be something that with the right partners could be done. So I would say we're going to investigate these things. That might be useful at the beginning to prioritize which ones are most likely to be successful, which ones are likely to impact the most people, which ones are likely to be cost effective, and which ones are likely to get community support. So I will support the idea of moving forward with looking at these alternatives, but I would say, staff's going to have to give feedback both to us and to the two boards on what they can and can't support and what the timelines realistically would be, but we don't see any erosion in the really good programs and the exits into housing that we're seeing right now. So yes to looking into it, but with the caveat that it has to be realistic. The homeless, unsheltered community needs our support. They do need the programs that we're talking about, but there are other groups in our community that also need our support. I could list many of them, but we need to understand that there's not an infinite budget, nor is there infinite staff time. When we come to the other questions that are in what staff asked us, I think, are we cool is the way Bob put it with what we're doing now. I think I covered that at the beginning, that many of the things that we're doing are quite successful, and our ability to evaluate that success is quite, much more advanced than it was a few years ago. So I would say, yes, let's keep looking for what additional we can do, but let's make sure that we don't degrade what we're already doing our success. And I will echo Aaron's point and Mary's point that we need to keep our eye on the severe weather sheltering capacity as we move into the winter. And that's all. Thank you.
Thanks, Sam. I've got Mirabai, then Junie, and then Rachel and Mary have additional things to say, and then I'll go and I'll try to recap. So Mirabai.
Just keep mine short and sweet. Thank you, Sam. I think you put that most eloquently, and I will second everything he just said.
Wow, you win the award for the most concise statement, Mirabai. Thank you. Let's see, Junie, then Rachel, then Mary. Junie, you can begin.
Yes, thank you. I do welcome the opportunity to engage into that discussion and also see what we can do, because I think tonight, if there's one thing that I realize, which I already had an idea of, is that we have two different group of people that we serve. We serve people who need housing and also people we know that can't be housed or are unable to engage in the system because of mental health reasons. So I think because of that, we also have to look into other opportunities to house them. So maybe we can't put them in permanent housing because they're not gonna stay there, because staying in an enclosed space is just not something that they can do because of mental health issues or other reasons. So I think looking and still engaging and finding solutions to providing safe space to these people are very important. So I welcome the opportunity to research more and look into how we can provide an open space where people can, where they can camp. And I think tonight we've talked about agricultural and industrial areas. So I think for me, the only thing I can say is that maybe staff can have these spots readily available so that if a partner wants to work with the city or find ways, have that information ready for them. Because honestly, when I was thinking of, I couldn't imagine where those places would be. So I think I'm not the only person who is unaware of where these places are. So I think it'd be good to have that research available and show us exactly where these campgrounds can be placed. Because again, it's about feasibility. So if we're gonna do a project, we want to know where and whether it's feasible. And I had also mentioned earlier about the parking repurposing, and that's something I think we should definitely look into. And I understand as well what Sam mentioned when it comes to staff time, especially during this really unprecedented time of stress and lots of work and demand on staff. Does council have any input on changes? I think, I think Kurt is doing a great job. Keep doing the job that you're doing. We just have to find ways to bridge the gap. And that gap are those people that are unable to engage our system though as is. So we have to be more creative. And I think just keep up the good work. And I know you have a lot of wonderful staff members who are just as creative, who will find the solution. So thank you for your hard work and all that you do, and keep that up.
Thank you, Junie. Rachel had more comments, as did Mary.
Yep, Aaron had asked us to kind of weigh in on severe weather shelter and whether we were concerned, and I would second, third, or fourth his concern there, that I surely am concerned that we don't, that we're losing available beds in severe weather situations, and also that we didn't talk through whether to use temperature triggers. So I don't know if we need to get into that or if that will go to HAB and HRC. And then just the second thing, I think Judy mentioned that they had established sort of 4 people to be on this
HRC, HAB committee. So it sounds like each group already designated 2 members, and then they wanted people from council. So I thought maybe we should establish that tonight. And personally, I would say if Adam were willing to do it coming from HAB, he might make a lot of sense. Thanks.
Rachel, Mary?
Yeah, I wanted to reiterate something that Sam said, that most housing and human services are administered through counties. Boulder is very rare in that it actually does some housing and human services at the city level through a tax that was established, I believe, back in the 60s. But it is highly unusual. And so therefore, I think that the HSBC, the Housing Solutions Boulder County, is a collaborative among communities within the county and including the county government. So therefore, that is where an oversight committee or something as such should reside. And that is where any search for folks that are have the lived experience should reside within that structure, so that they can advise at that level, because we do not have that at the city level, nor do I think that we should have it at the city level. It would be more effective at the county level. I want to be real clear that my support for looking into the safe parking and campgrounds is from have it come from a community-driven private effort. I do not support staff putting any time into it beyond what it might take to approve a use review. So that's where I'm coming from. I really do not want to expend any energy on something that takes away from coming up with housing solutions. We don't have data, very much data available. So if HRC and HAB can present that, I know that it's out there, but it's not all in one place. And many community members wrote in saying that we, the council members, should Google it. So I think that that's the kind of work that HAB was appointed to do, is to do that research and present that data in a collected and cohesive in one place kind of manner. But I do not support having staff expend energy on it. I want it to come from the HAB members and to look for a community organization and private funding to make it happen. And then the other thing I wanted to say is, to add to that, is that the Longmont safe parking as well as the Denver safe parking are all coming from community-driven programs. They are not city supported. I believe that all governments are supporting the Housing First solutions that align with, national evidence-based programs and best practices. So I just wanted to make that clear. Thank you.
Thanks, Mary. Adam had another comment?
Yes, I did, Bob. Just a quick follow-up to Mary. I totally understand where you're coming from as far as the community-driven approach. I just don't want to prevent HAB and HRC from doing their own work. I remember when I was on HAB, we asked to look at occupancy limits, and we were told specifically by council, don't look at occupancy limits. So I wanted to avoid a situation like that where they wouldn't either, have the green light or be able to look at it at all. It doesn't sound like that's what you want. I think we're trying to meet exactly what they want by spending their time and their resources on looking at these issues further. I also wanted to say I share Aaron's worries about severe weather sheltering, just to tick my check in that box. And as to Rachel's idea of a board member helping between the two boards and council, I love being volunteered for additional work. So I'm definitely on board to do that if HAB and HRC want that going forward.
Thank you, Adam. I don't see any more hands, so I'm going to go ahead and give you my comments, and then maybe I'll try to summarize what we've heard from everybody. First of all, I do want to thank and congratulate staff on an outstanding presentation, probably one of the best presentations I've seen and heard in my 4.5 years on council. The memo was thorough and comprehensive, and the presentation tonight was excellent. So thank you so much to everybody who was involved in the presentation. Very, very good. I want to express enthusiasm, which others I think had expressed earlier in the presentation, over the Be There program. I think that sounds exciting. I've been advocating for years for a program like that, where we have non-police involved in outreach, social workers, people with lived experience, people who provide services and understand those services. My son did that for many years in New York, and I know the value of those services. Our cops are great, but if a cop shows up with a person on the street, it's a different dynamic than if it's someone there who is there to provide a different type of support and service. So I fully support the Be There program, and I'm very excited about having that launched soon. It sounds like there's support by most people to have HRC and HAB do some additional work. I'm going to say that I do agree with Mary and Sam in their caveat or their caution that we need to be thoughtful about who actually would pay. I'm sure that HAB and HRC could come up with some really great ideas, and then the question is who foots the bill for that. I do worry that this is zero sum, that dollars we take away, the city might apply to one of these new programs would be dollars that we take away from putting people in housing, which of course is the ultimate solution. So I do agree with Mary and Sam that while I think it's fine for folks to further investigate this, the type of things that I would consider supporting really would involve private dollars and private initiatives, and not divert from our goal of providing housing to people who need it. So that's kind of where I'm at. I'm not telling HRC or HAB what to do. I'm just foreshadowing where I will be on whatever recommendations, and I'm not going to be enthusiastic about city money for any of those types of things. I do want to read a couple of sentences from the memo, because for me, we've been spending a lot of time tonight talking about how we could add things and do new things, and add more beds or more virtual beds. And I think that's fine, but I think there's a threshold question, which is, who are we going to serve? Because obviously there are far more homeless people in the state, in the country, than we could possibly serve. And we're serving people who have no connection to Boulder whatsoever. We're one of the few cities up and down the Front Range that provides extensive services. And the question I think we have to ask ourselves before we say how many more beds do we need is, who are we going to serve? And let me just read this passage from the memo. It's page 9 of the memo. Between January and April 2020, so just the first 4 months of this year, 326 people were screened through coordinated entry in Boulder. During this time, 83% of the people referred through coordinated entry were new to Boulder County, with 71% of the total being in Boulder County for less than 1 month. Of the people who reported being from places in Colorado, but not from Boulder County, 71% are from Denver. So I do think I would ask HRC and HAB, as they consider recommendations on new interventions and new programs and new beds, to also ask the question, what is the limit of our capacity? What responsibility do we have? Do we have the responsibility to provide housing to people from Denver, from people from outside of the state, from people who have been in Boulder for days, or in many cases hours? And so the question is, who do we serve? Because I think we have to ask that question, answer that question first, before we say, do we have enough beds? Because obviously, if our view is we're going to serve all comers, we'll never have enough beds. It doesn't matter what intervention or how many campgrounds or how much safe parking we have. If we are going to serve every single person who shows up and says, I want service, we will never have enough beds. So I think we need to first decide who shall we serve, who do we have a responsibility to serve, and then decide whether the beds we have are adequate, and if not, what solutions we have as alternatives. So that's all I have to say from my perspective. Let me just try to recap what I think Council said in the last 45 minutes or so here. It sounds like there is support for HRC and HAB to do some further work on other interventions. Some council members would like to see that focused on the options for private interventions. Other council members didn't express that view. There seems to be a pretty uniform concern around severe weather service beds and whether they're going to be adequate. That may be something that staff wants to take out on its own, separate from the HRC HAB review, because we're only 3 or 4 months away from severe weather season. And so if staff has some other ideas in severe weather sheltering, you might want to bring that back here in the next couple of months, independent of the work that HRC and HAB might be doing. There was an expression of concern for housing people with meth addictions. There seemed to be enthusiasm for the Be There program. I think that handles it. I hope I did a fair job of summarizing what people were saying. If anybody has something to add to that or disagrees, raise your hand right now. Aaron has something to add.
Yeah, it was a good summary, Bob. Thank you. I'll agree with what you said about the severe weather shelter, coming back with that on a different track than working with HRC on the other questions. So that would definitely be my request. And it sounded like there was a majority that was interested in that. So I want to make sure that we have some options before the sheltering season starts.
Let me suggest, thanks, Aaron. Let me suggest one other thing is, there was a suggestion that we designate a council member to be a liaison back to those boards. I might suggest, thanks for being willing to be volunteered, Adam. I wonder if we should take that up at a council, 1 or 2 council meetings down the road, in case there's somebody else who may be interested in that and just didn't speak up. So I'm going to suggest that maybe CAC schedule 5 minutes at one of our next meetings just to say who all wants to be that liaison. Do we want 1 or 2, and who all wants to be it? So we know that Adam's willing to do it, and if others want to do it, they can express themselves in that meeting rather than trying to do that on the fly tonight. Any objection to that? Okay, hearing none. Any other comments on this? We have a really short presentation. We've covered actually some of this material already. But Tom, I think you were going to make a presentation on, by way of follow-up to a discussion we had a week or 2 ago about use of cars and campers.
Yes, thanks, Bob. And Sarah, I assume you're trying to put the presentation up?
I am. Just give me a second.
Of course, thank you. This is, I'll start with the presentation you saw last week to sort of ground you in where we are. And then I have some data on number of tickets and a small amount of racial data on one of the 2 ordinances in question. So, which was in the memo. So I'm going to start talking, and then I can go through the presentation when Sarah is kind enough to get it up. And there she goes. Can we go to the next slide, please? Or can I control this, Sarah? So as you'll recall, last week you approved Ordinance 8402 to amend the overnight parking rules for trailers. This arose because the municipal court had refused to enforce some tickets based on a reading of the ordinance regarding moving, and basically a dispute the city had with someone who owned a shave ice truck. Next slide, please. These are some pictures of some vehicles, which Adam and I kind of went back and forth over last week. I agree with him that they are mostly seem to be residential vehicles. Next slide, please. This is the first sentence of the change. You can see that previously it just prohibited them from being on the street for more than 24 hours. We've created some exceptions. Next slide, please. This is another one, the 72 hours for service vehicles, one more. And then by permit. So if we go to the next slide, and then this was added to deal with someone who's moving at a few inches on the same block to avoid the restriction. Next slide, please. So some of the background that we've got is that these tickets are issued on a complaint basis, and I'll give you the exact numbers, but basically between 100 and 150 violations a year, the complaints often have to do with safety issues, blocking sight lines and bike lanes and things like that. And then the problem, we tried to find racial equity data on who's getting these tickets, but of course parking tickets are issued to vehicles, not to people. So there's no data maintained on the race or ethnicity of any any person who's issued a ticket. So between July 7th of 2019 and July 8th of 2019, there are 143 violations issued. Between July 9th of 2019 and July 9th of 2020, there were 131 violations issued. So the 100 to 150, basically the midpoint of that. Next slide, please. So one of the things that we mentioned last week was that there's an ordinance called unlawful use of vehicle as residence. So as I understand it, if the parking enforcement folks see someone sleeping in a vehicle, if it's occupied, they do not write a ticket. They call the police, and the police issue this violation of 563, unlawful use of a vehicle as a residence. So since 2014, there have been 28 tickets issued for violation of section 563. That's the total for those 6 years. 3 were issued to the same person, a white male, over a couple of days in 2017. Of the 28 tickets, 22 were issued to white males, 5 were issued to white females, and 1 was issued to a black male. So 96% of the tickets were issued to Caucasians. Next slide, please. So this is a breakdown of the tickets as issued by year. As you can see, no tickets have been issued year to date 2020. The biggest number was 2018, 8. Sometimes, of course, in 2015, 2016, they issued a bunch of warnings, but still very small numbers, averaging less than 5 a year over 6 years. Next slide, please. Any questions or discussion?
Okay, thanks for that, Tom. Aaron, your hand's up, but I may have been from the last presentation. Does he speak up, Aaron, if you have a question? Otherwise, anybody else have questions, raise their hand. Aaron's hand is down.
I guess it's late, but I apologize for missing the meeting last week. Can I just get a better sense of what was asked for last week and whether we're thinking about changing anything about the ordinance, or what's our scope of this agenda item?
I'm sorry, Aaron. There's some community members who expressed concern that this ordinance was used to target homeless individuals. And the council wanted to have some discussion, at least some protection of additional data. And there was a request that we apply an equity filter to look at it. And we've done that as best as we can. We're asked to bring it back for discussion this week in conjunction with the homelessness discussion.
Okay, I guess I will ask a question since I sort of have the floor. Less about homelessness, but what about the issue of, say, folks who own a small commercial trailer? Like I see them occasionally a landscaping trailer around my neighborhood, and who don't, say they live in multifamily housing or something and don't have another place to park it. Like, would they be able to move it from one block to another and cycle around and kind of keep it working that way? Or
yeah, although the preference is that a business, we prefer the business find a place to park it off the street if they're running a business. Of course, you can create it. And so one of the things that we did do was create an exception, which did not exist before, for businesses that were providing services in the community to stay at a house that they're working out for up to 72 hours. So they don't have to
Park it.
move.
You can park it where you're working as opposed to, where you live, say.
Yeah.
Okay. Well, I guess I understand some concerns around that were raised last week, and it does seem like there is an equity concern there.
Adam has his hand up.
Thanks, Bob. Yeah, mine is just a carryover from last week too. Since you're looking for comments, Tom, the only concern I have is it doesn't state how long the trailer has to be gone or the RV has to be gone before it can come back to that spot, which I think leaves open a different set of loopholes in the long run. So maybe that needs to be addressed at some point too.
Okay. Thanks.
Thanks, Adam. Mary?
Yeah, I want to go back to Aaron's point about someone who lives in multifamily housing and has, say, a landscaping business that has a truck with a trailer for their landscaping business. What options exist for such a situation? Do they have to go out and find some alternative parking space elsewhere?
I think that's the expectation, that a business will find a place to store it, a commercial storage yard or something like that.
Okay, yeah, I would agree with Aaron that does present. Tom, are you aware of any cities anywhere that provide some accommodation for such a situation?
No, I've never heard of that, but I mean, it's fairly common to not allow commercial vehicles, but in fact, we don't really even allow cars to be parked on for more than 72 hours, although that's something that's ignored throughout the city. And Mary, one of the things I wanted to emphasize is that this is complaint-based, so we don't have parking folks out looking for violations. It's when someone in the community is concerned, and as I said, many of those concerns are raised by safety issues. So my guess would be that you generally would not see a community going after one of their own. So we probably would not get complaints in that situation. Although I can't say that we don't have any data on that at all, Mary.
Okay, thank you.
I'm going to call myself and throw out a suggestion. I think one of the exceptions that we did pass last week was a permit issued by the city. And I almost wonder if in those situations that Aaron and Mary were referring to, where someone's in a multifamily dwelling, there's not a parking space or a parking driveway for them to put their trailer in, if we could have a mechanism for those people in those businesses to apply for a permit. Maybe there's notice to their immediate neighbors to see if anybody is fussed about that. And if no one's fussed, we could issue a permit for trailers to be parked for longer time or indefinitely in those circumstances. Is that something that we could do? I know that we created an exception. Is there a process that we could then take advantage of?
Yes. That was the intent of that, I think, Bob.
Okay. Any other comments or questions for Tom? Don't see any hands up. Kurt, if you're still on, I'm sorry, I should have asked you if you got all the guidance you needed.
I did. I'm just hanging on for the rest of the meeting to observe this.
Okay, great. I think that is the rest of the meeting. Unless anybody has anything else, I think we're done. Anybody have any either meeting debrief or other comments?
Just wanted to say thanks for running the meeting, Bob. You did a really nice job.
Sure. Sorry it went long. We had a lot of interest and enthusiasm, and to be fair to those of you who've joined council in the last year, this is, I think, the first deep dive we've had on homelessness since you guys have joined. We were all first year council members and had lots of the same questions that you did, and we've learned along the way. So it was great to hear your questions and to hear the staff's answer. And so I hope we're now pretty close to on the same page from a fact standpoint, and we've got some work ahead of us. Any other questions or comments? Okay, with that, I think we're adjourned. Thanks so much, guys.
Good night.
Thanks, everybody. Good night.